close are you to starting? Do you have everybody here?
So we're going to call the meeting in order. Thanks, gentlemen, and I appreciate you being here. We didn't have a quorum in the last meeting. Some of the people were here for the when we had the presentation on the economic impact study. So I want to appreciate that, and that's what we're here to pass. So, Madam Clerk, are there any changes to the agenda?
No changes, Mr. Chair.
Is there any declarations of interest, the board members here? No? We need approval of the minutes of the previous meeting, which is March the 7th, 2014. Moved by Councillor Whitehead. We have a seconder. Councillor McCaddy. All those in favor? Do I have a motion to receive the minutes of the June 27, 2014? And that's the economic impact. And do we have a seconder? Yes. All those in favor? Any against? And so we're going to receive the minutes. So to the committee, I would suggest that we look at three different scenarios where we can go forward. And if I can get your attention there, that, and I'll put this in a motion form, that the staff complete the economic impact analysis and bring the results and final recommendation to the next deal committee meeting in September 2014. The second one I was looking at, that each city department work with the internal staff to quantify the potential impact on respective department budgets within the various scenarios laid out. And third, that the mayor, chair of the Steel Committee, city manager's office, and key city staff meet with the appropriate federal and provincial government elected officials to discuss these matters, and that part of the discussions with the provincial government be focused on information regarding the Pensions Benefits Guarantee Fund. So I have this all there and everybody understands, so I'll move that forward. And if we have a seconder?
Yeah, I'd move it, Mr. Chair, no problem at all. Secondly, at this point, I want to take the opportunity to, thank our staff for a very comprehensive report on some of the implications. I want to extend that to everyone that worked on that report. I also want to apologize to those, my understanding the last meeting, Mr. Chair, you didn't get a quorum, and I extend my apologies to those that made the effort to be here. But I did talk to the chair well in advance of the meeting. In fact, tried to get the meeting, because I thought it was important enough, I tried to get the meeting changed. It's the same period I take a book with my family. It's a reunion that I attended in Elliott Lake. And unfortunately, I couldn't be there that particular Friday. But I did everything I could to see if I could be accommodated, understanding that there's many other people that need to be accommodated. I couldn't be there. I read in the Mountain News a bit of a criticism for taking that holiday. It's unfortunate. These things happen. And I regret that you didn't have quorum, but I just want to certainly provide the explanation that I had booked this several months in advance of this meeting being scheduled on that particular Friday.
And I thank you for that, Councillor. I don't have a problem. And you did, I know you had made previous commitments, and it was well explained that you had vacation with your family. So it was just one of those days, and I think everybody understands that. There was just some hiccups, and we thought we had quorum, and unfortunately we didn't. But everybody had a valid reason, and it wasn't until we found out to that day. So I thank you. So on those motions, we have Councillor Whitehead and Councillor Murillo, you seconded. So for all three motions, or we have to do one at a time, Madam Clerk?
We can combine them in one motion.
Okay. So all those in favor? Carried. Any against? It's carried. Thank you. And Mayor, motion to adjourn the meeting. Councillor Whitehead, Councillor Murillo, all those in favor? Thank you.
Yeah, always a bit of that. I definitely want it. to get this meeting going. It's quite a lengthy agenda today. We have a number of people waiting for us, and so I will call this meeting to order. Members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. Other individuals in the media may also be audibly and/or visually recording this meeting. Also, I wish to advise the board members that due to some matters on the agenda being time sensitive and the council meeting being held tomorrow morning at 9:30, council will be requested to waive the 48-hour rule tomorrow in order for the board to present its report from this meeting. Madam Clerk, are there any changes to the agenda?
Yes, we have 5 added delegation requests. 4.1, David Carson, respecting item 7.3 in the agenda, requesting to speak today. 4.2, Sally Palmer, respecting the Good to Go Food Box pilot project for a future meeting. 4.3, Don McLean, respecting item 7.3, requesting to speak today. Item 4.4, Dr. James Quinn, respecting item 7.3 today. That's requesting to speak today. And item 4.5, Robert Clark, respecting item 9.1 on today's agenda, also requesting to speak today. And also, Mr. Mayor, I would ask that the board please hear the presentation from the LIN following the approval of the minutes.
All right. Any comments on the agenda? Councillor Clark.
Just curious, what's the time sensitivity that we have to waive the rules for tomorrow? What's the urgency?
On the board presentation? So I could ask Dr. Richardson, is there a pressing issue within the agenda that you feel needs to come before the council tomorrow? I think the problem is the next meeting is well into August.
I understand that, but it's still a problem for the public when we make decisions here and ratify it 24 hours later.
Through you, Mr. Mayor, there's 2 particular issues that I'm aware of, and I'll just turn down the road to see if there's any others, but there's the vaccine program presentation you're going to have, which is going to be about changing the way we do our vaccine programs, which need to be rolled out in August, and so we can't wait till August for approval. That planning is already well underway, or will be well underway by then. And as well, in terms of the procurement of the airshed model, that's something that we want to get moving on in order to move that project forward within a more timely way. So we would like to, it's been quite a delay in getting there, so we'd like to move
One of them
forward on
has a
that.
significant cost value?
Pardon me?
One of them has a cost value attached?
The airshed model procurement, you're asking?
Yes?
Yes. It's not like significant in terms of, I think it's 140,000, Rob?
I'll wait until the appropriate time tomorrow, but I have no problem with the vaccine going forward, but we should be having some opportunity for the public to comment as opposed to just ratifying when we're making expenditures. Thank you.
Councillor Whitehead.
As far as the strategy, I believe that's in the auspice of the medical doctor of health. It's the if there's a financial implication, then obviously it would be an issue that we would have to deal with before tomorrow. So did I hear that even on the vaccination there's a financial implication?
To you, Mr. Mayor, the issue, the finances have been approved. It's not a new funding. It is the procurement method that we're asking for, like an agreement with somebody else. So it's not new funding or a new decision around funding. It's just how that funding is going to
Fair
be
enough.
used.
Thank you.
Okay, so may I have a motion to approve the agenda as amended? Do you speak to that?
Yeah, I'd like to just make a comment from agenda approval perspective. I have police negotiations starting at 3, so for quorum purposes, just so that you know.
I'll also have an issue around 4:30, but Councillor Partridge, did you want to speak to? Okay, on the motion to approve the agenda? Move. Okay, Partridge, Ferguson, all in.
Notice I'm on part of the same negotiations at 3.
So it looks like we're going to lose quorum at 3. Thank you. So motion to approve the agenda, all in favor? Declarations of interest. Just before I call on the Lynn, as we just agreed to in the agenda, what I'm going to suggest so that the delegates understand that they may or may not be heard, what I'd like to do now is move all of the delegation requests that are before us, which is David Carson, Sally Palmer, Don McLean, Dr. James Quinn, and Robert Clark. All of these require a motion to waive the rules of order to allow those delegations to present today. So does anyone have any So moved?
That's okay with us.
Yep, okay. Marula, Morrow, all in favor? Carried. So the delegations, you will be heard today. Hopefully we'll still have quorum by the time we get there. And so now we go back to the change that we agreed to in the agenda. As requested, we have the presentation from the LHIN before us, and I'd like to call upon Donna Cripps, CEO, Hamilton Niagara Haldeman Brandt LHIN, to provide a presentation respecting the Local Health Integration Network. And I understand you have a helper, a well-known and much-loved Michael Shea.
Thank you.
Please go ahead.
Thank you very much. Thanks. Good afternoon, and on behalf of the Hamilton Niagara Haldeman Brandt Local Health Integration Network, the longest name of all the 14 LHINs, Donna and I are very pleased to be able to come and speak before you today, and thank you for the opportunity. I'd like to congratulate and thank you for the tremendous work you're doing for local citizens in making Hamilton the best place to live, work, and play. And specifically, I'd like to acknowledge the great work that the Board of Health is undertaking as part of the Neighborhood Development Strategy. The strategy aligns very well with what we, the LHIN, are doing as part of our Strategic Health System Plan, and specifically Health Links, which Donna is going to talk about in just a few minutes. We too want to build healthier communities, and we know that making targeted impacts is what's going to lead to that result. I just want to talk a little bit about LHINs and how we got to where we are. Like, it was March 2006 when the Government of Ontario passed historic healthcare legislation, the Local Health System Integration Act. What it did was move local decision-making on healthcare to the local level by creating 14 local health integration networks that are based on 14 different geographic areas within the province of Ontario. LHINs are not-for-profit Crown agencies that are responsible for planning, integrating, and funding local health services in these 14 geographic areas. Our LHIN's guiding vision is a healthcare system that helps keep people healthy, gets them good care when they are sick, and will be there for our children and grandchildren, which means it'll be a sustainable system. The HNHB LHIN, we cover all of Brant County, of course, the entire city of Hamilton, the region of Niagara, Haldeman County, Norfolk County, city of Burlington, and it covers an area of about 7,000 square kilometers. It's not just the city of Hamilton, and a population base of about 1.5 million people, of which about 70% of them live within Hamilton and Niagara. Our LHIN budget is $2.8 billion, and that is dispersed to 194 health service providers within the LHIN geographic area. And the actual operating budget for the LHIN itself is about $6.2 million, which means it's about 99.8% of all the funding actually goes to frontline services to the service providers. The LHIN, like all LHINs, is accountable not only to the Ministry of Health and Long-Term Care, but also to the health service providers and basically to the communities that we serve, the people that live within the LHIN. The Ministry, the LHINs, and the health service providers are each responsible for developing and fulfilling clear and achievable performance obligations and to identify any risks of performance. We have accountability agreements, us as a LHIN with the Ministry, and then Donna and I sign agreements with all 194 of the service providers within our area. And they're held to account with those accountability agreements. All parties are expected to work collaboratively and cooperatively by establishing clear lines of communication and responsibility. I'm now just going to turn it over to Donna. I'm just doing the introduction part, and Donna, our CEO of the LHIN, is going to talk about our plan and about Health Links. Thanks, Donna.
Welcome, Donna.
Thank you very much. Thanks for this opportunity. As our board chair said, we have been involved in a fairly extensive strategic health system plan where in 2012 and into 2013 we engaged about 2,000 residents throughout our Lynn geographic area to understand what did they feel that they needed from their health system. We looked at leading practices around the world and tried to say, what is it that leading practices around the world who are getting better outcomes are doing that we're not doing that we could maybe learn from? And in addition, we did some work with a consultant, and really what we came out with was a strategic aim that talks about dramatically improving the patient experience by looking at quality, integration, and value. And everything that we've been doing since that time links to this. Because of our time today, I just want to focus on that integration piece a little bit. What we found when we were looking around the world at what health systems work well, we found that the way health providers come together and care for a patient can make a very big difference to the outcomes for that person. And in Ontario, quite often we have the family physician over here, kind of in their own area, and then the rest of the service providers over here. And what we found was when you looked, whether you look at Scandinavia, Australia, the UK, when you bring that together, you put the patient in the middle, and you bring all the providers together, including the physicians, and create a coordinated care plan for a patient, you actually get to much better outcomes. So the province has launched a program called Health Links. It's geographically based, so that there's geographic areas, because we know, for just even looking in Hamilton, the needs of the people in the downtown core of Hamilton are probably different than the needs of the people in the west end of Hamilton. One of the things that we're looking at with this Health Links is looking at the people who use our health system the most. So we do know that 80% of the people who use our health system, 10% of the people who use our health system take 80% of the funding. So 5% of the people that use the health system do about 66%, and 10% do about 80% of the health funding. So if we can really focus those people who are really using our health system to a great degree, we can probably figure out how to provide services in a better, more efficient way. And so Health Links is really helping us do that. Just so you can see quickly, geographically, we have 11 Health Links in our Lynn area. There are 3 in Hamilton. There's the Hamilton Central Health Link, Hamilton West, and Hamilton East. And we did separate that out because there are quite a high number of high users, if you will, in the Hamilton area. Just to give you the idea, we have about 1,000 high users in Hamilton, Hamilton East with the most, but Hamilton East and Hamilton Central, about 400 people who we consider high users. Definition of high users that we used was a person who went to the emergency department 5 times in the past year, plus was admitted to hospital 2 times. So 5 times to the emergency department plus 2 times in the hospital in a calendar year would put them into that high user category. And so what we're trying to do here is we're trying to then bring together providers, but not just providers, health service providers, not just your typical health service providers, but bringing people like people from the city who sit at our Health Links table with us, to be able to say, we know that there are social determinants of health, like housing, that really make an impact to a person's well-being and to their health outcomes. And so what can we be doing differently? In some of our Health Links, there's a no smoking, a stop smoking group that has come because they're very integrated in that community. And while they don't get Lynn funding, they can very much make a difference to the people around the table. The people who are identified as high users, the things that we're seeing, the diagnosis that we see, just to give you an idea, is these people are typically over 65, not all of them, but more of them are over 65 than not. They have things like congestive heart failure, emphysema, chronic bronchitis. They're at the end of their life with a life-threatening illness. Many of them have mental health issues, and many of them have addiction issues. You can't read that, and I appreciate it, but just suffice it to say, you have your presentation there. There are 11 indicators that we're using to try to see, are we making a difference? Some of them on the left-hand side are the early indicators, so very process indicators, the number of care plans we've developed for people, and then the ones over on the right are more long-term indicators. What our rate of the alternate level of care in hospitals, would that go down? Reducing the average cost of delivering health services to patients without compromising quality of care. I mean, you won't see those for some time. So we're 1 year into the HealthLinks experience. And this is really a neat opportunity where we've been working closely with the city and your staff, particularly Paul Johnson, because the work that you have done and the work you have led as it relates to the neighborhood development strategy, because many of these health links are linked into those neighborhoods. So Paul and his team have been very good to work with us and to try to bring that city perspective to things. Where we're going with HealthLinks, in the ideal world, we would like to be able to predict people who are going to become high users of the health system and actually intervene with them long before they end up going to the hospital for all those times in a year. We're not there yet, but that's our hope, to be able to do that. I know also that ambulance offload is a particular area of interest to the Board of Health here. And so I thought that I might mention to you a few things about what the LHIN is doing as it relates to the emergency department in hospitals. It's very interesting to us at the LHIN that in fact the emergency department visits have gone up very significantly, about 19% a year over the last 3 years. So our emergency department visits are going up, despite the fact, by the way, I should have mentioned it on the slide before, in the HealthLink, Hamilton Central HealthLink was an early adopter HealthLink, so they've been up and running for about a year, and there is about a 10% reduction in those high users in their use of the emergency department in year 1. So that's good. The HealthLink should help us with some of this, but we know the emergency department visits are going up. Interestingly, the acuity of the people that are going to the emergency department is also going up very significantly. So the people that are going to the emergency department are not people who don't need to be there. They're people who do need to be there. We do the CTAS. It's a way of categorizing the people who come into the emergency department, and on the lower levels of that, categories 4s and 5s, have actually declined quite significantly in the last couple of years. So the people going to emergency department is greater. Their severity of illnesses has increased. The people that don't need to be there are not going there, or there are less of them going there for sure. So there's something going on. We certainly have an aging population, and we know that for sure. I do want to just quickly say to you that there's really two things that we're working on as it relates to the emergency department. One is trying to make sure people don't go to the emergency department, so we call that emergency department diversion, but also looking at how can we be sure that the people who are in hospital can get back home as quickly as possible so that there's flow through the system, because that certainly affects you and your ambulances. I can go through all of these just really quickly to say that the CREMS program, I think you're really familiar with. It's a community paramedicine program, fabulous program, started here in Hamilton with the innovative work of you and your team, and it's a good program and has got some legs, if you will, across the province. A number of people have in the past gone to the emergency department to see an internal medicine specialist. We've set up some rapid access clinics where the person doesn't need to go to the emergency department. They can be referred right over to a different area in the hospital to see an internal medicine specialist. Community Care Access Centers has coordinators right in the emergency department, so if you go in and really it's a social situation, they can be assessed by the CCAC workers right in the emergency department and hopefully go home without having to be admitted. We've been working with physicians and other health service providers in the community on what we call a frailty screening or screening high-risk seniors. There's ways of predicting as you get older how if you're going to become frail in the next while. And by predicting these things, we can put services in place to help prevent the need for you to go to the hospital. And certainly having some nurse practitioners in the long-term care homes helps the long-term care homes deal as best they can with the things within the home so that that person in the long-term care home doesn't need to go to the hospital unless it's absolutely necessary. There's a number of things that we're working on as well about transitioning people from the hospital out into home, and they're listed there. And just to conclude and try to be sensitive to your time, just remembering that really healthcare, this particular study suggested it was about 10% of a person's health is the actual healthcare system, that there's so many other things, and I certainly don't need to tell this council that. I think that you in the province have shown incredible leadership as it relates to really understanding those social determinants of health. So at a high level, that's our presentation for today.
Well, thank you very much. And I do have a speakers list, Donna and Mike, and we'll start off. We have Councillor McCaddy, Councillor Jackson, Councillor Ferguson, and Councillor Whitehead. Councillor McCaddy.
Thanks very much, Mr. Mayor, and thanks very, very much for coming today. We've been awaiting this visit. It's really important to us because the two organizations, the Board of Health, Public Health Services, and City Council for that matter, but the LHINs really, I think in our view, speak for Board of Health at my peril, but I think really need to work much closer together. Yeah, and I think over the years, we've kind of looked across and wondering what the LHINs are doing, and you may be wondering what we're doing on a daily basis, I imagine, but especially when you read the spec. But it's really important that we kind of come together, because otherwise it becomes a bit more of an us and them, and what are they doing and what are we doing? So being here today really contributes to that. So Mike and Donna, thanks very much for that. I'm really excited about your strategic approach. We've read about that, in the spec and elsewhere. David Price from Family Medicine at MAC has spoken about that specifically. And so I think for me, my other role here is as president of City Housing Hamilton. Okay. So we probably have a number of those folks that are ending up in Emerge, and the CREMS program has really helped in some of our buildings, working with Brent Browett and others here at the city. Mm-hmm. But I'm just wondering whether we could try and establish a better relationship, a closer relationship between city housing, 7,000 units across the city, and a lot of vulnerable Hamiltonians. Many of them I'm sure you've identified as well in your information. And in that case, really what we're talking about, and it's all about money, and much of the time it's the kind of supports we need for our tenants, our residents, in order to keep them in housing and keep them from getting to Emerge, which sounds like this is the same interest you have. And I wonder if you could tell me a little bit about that possibility. And of course, given our time and whatnot, we can maybe meet afterwards. For sure. I know you meet with Brenda Osborne, our CEO, from time to time as well.
Yeah, for sure. Thank you for that. I think that's exactly the issues that we want. The people that you're speaking of are already in housing that's congregate, that's together, which means that we can provide services, or the service providers can provide services in a very efficient way. So I'm happy to have further conversation with the city housing, for sure. They are linked in with the health links, but your point's well taken, and thank you for that. I appreciate it. I agree with you.
Yeah, we certainly need that kind of support from the LHIN. And the other one, maybe just taking advantage of, and I'll ask the question, not expecting much of an answer, I don't think, today, but we have a report in a couple of moments that talks about concerns around air pollution and effects on health here in Hamilton. It talks about 700 or so premature hospital admissions per year, which probably come, a lot of them through Emerge, you would think, on the way in, and then may end up elsewhere in the hospital. So I'm wondering if that's something that we can work with you on as well. And I'm hoping that a lot of what you hope to do, it's a huge task, Mr. Mayor, but prevention is a key, right? So we need to work. We'll talk about it later on this afternoon about reducing air pollution problems in Hamilton. Right. So we don't get those numbers, but how do we work with you on that? I mean, it's we always want to stay away from the end of pipe solutions. We want to back it up and find out why are these people being admitted prematurely to begin with, and can we work with you through Ministry of Health, but also through Ministry of Environment and Climate Change, I guess they're called now, to get some more serious response on air pollution, because it directly leads to emerge and into the hospital.
Your point's so well taken. Our vision talks about keeping people healthy and clean. And one of the high users, one of the big things that we see with that are people with emphysema and chronic bronchitis, to your point.
Yeah.
So when you're making some policy decisions at the level you're making those policy decisions, they directly impact what's going to happen downstream. So tremendous point, and happy to work with the City of Hamilton. I think that our relationship has improved over time, and I want to continue to make that happen.
Well, it's great to hear, Mr. Mayor, and again, thanks very much for coming today. I'm hoping this is sort of opening the door into our relationship and continuing to improve it, and I very much look forward to working on some of these issues with you.
Thank you.
And good to see you again, Mike, as always. Thanks.
Thank you, Councillor. Councillor Jackson.
Thanks, Mr. Mayor, and Donna and Mike, thank you very much for coming in. Long overdue. I want to echo Councillor McCaddy's comments. Please don't make this a once and only type of visit, because it would be great if through Dr. Richardson we could make this even an annual or semi-annual to stay in touch. A couple of quick questions. The LINS provides funding for the CCACs, correct, Donna, Mr. Mayor, through you?
Yes, that's correct.
So, Donna, could you put back up quickly slide 5, please? Because I want to just, through a real-life family situation, thank you. So real fast, through a real-life family situation, and a member of the family that ended up going to be with the Lord 3 years ago, her Lord, you see your top 3 circles, long-term care, hospital, and home care, and I take it the CCACs would be under the home care bubble there.
Yeah.
And more research I've done the last 3 years, there seems to be a disconnect, Donna, between when a patient exits from the hospital environment back home under an assessment, the CCACs funded by you comes in, does their assessment. If that individual through emergency services must go back into the hospital environment from the community environment, they start all over again in the hospital environment, and when they are possibly discharged back to the community environment, to their home, waiting for an LTC, a bed to open up, the CCAC that's funded by you says, Mrs. Williams, we've got to start all over again with our assessment. Time is lost. Mr. Mayor, through to Donna, are you aware of that? Is that something we're working on, please?
My goodness. Yes. So I am so aware of that, and thank you for articulating it so passionately. There's a number of enablers that can help that. So some of it is that the hospitals have, over the years, been a silo here, and the home care has been a silo here. And people tell us that while they're in the hospital or while they're in home care, things go reasonably okay. It's when you have that transition, right? Just exactly what you're saying. One of the things that we've really worked on is how can we communicate between the providers in the most effective way so that there is easy communication, if you will. So that becomes the electronic health record. And right now, and I could go on for a long time on this, but in Hamilton, we have about 4,000 physicians linked into what we call Clinical Connect, which is a viewer. The CCAC is connected in, as are the hospitals, and the long-term cares are just starting to come into that now. So what that means, and the labs are all in that, so what that means is a doc or a person in the hospital or the home care worker can go onto the computer with the proper authority, the privacy screens in, can go in and see Donna Cripps, okay, yeah, she's been in the hospital, here were the drugs that she was discharged on, here was what she was able to do functionally, and those sorts of things. So we've been able to do that over the last number of years, and that's really, really exciting. The physicians love it. And
it's encouraging, Donna.
It really is. It really is. The best feedback I have is when someone from St. Catharines says to me, well, I had surgery in Hamilton, and I went to see my doctor in St. Catharines, and he knew about my surgery right on his computer screen, and I'm going, yeah, that's how it's supposed to work.
So that's encouraging.
It's getting better.
And I know it's more complicated, but I'm so thrilled you've got that on your radar, as it sounds like, as a priority.
Yes,
I would strongly exhort you to carry on that way.
Sure.
Secondly, Mr. Mayor, last question. The emergency, our medical services, our EMSs, you know the pressures you've alluded to at the offloading. the McMaster decision that was done,
Yeah.
so be it, over with. It
Right.
did put pressure financially on the municipality. Can LINS help us with that argument, with the province and the funding? Independent studies have shown we may be up to $1 million, $1.5 million extra pressure on our budgets because of decisions at McMaster, the adult closure, whatever done. But that kind of financial pressure on our EMS. Mr. Mayor, through to a partner, possibly, now moving forward together, is this something, Donna, you and Mike can help the municipality take that argument to the province? Because there's a budget pressure of a decision that we didn't make, but now there's become some, there's an outcome financially to the municipality. Mr. Mayor, through to Donna or Mike for a comment, please.
We certainly want to work with you in every way we can. And just like I said, with all the emergency department, what we're trying to do to stop, to lessen the impact for the emergency or for your ambulances and the EMS, for sure. To the extent that we could, and we could back it up with data, you know, I'm willing to look at that, but what we tend to do is try to look at the patients that we currently have in place and see how can we stop them from going to the emergency department so we can lessen that, because the demand is just too much.
So, Mr. Mayor, to wrap up, maybe through Dr. Richardson and through our new EMS director, Michael Sanderson, Council passed a resolution asking for help. Maybe that resolution with the backed up evidence and data we have could be forwarded on to you, Don and Mike.
That'd be great.
That at least for discussion, stay in touch with us, please.
Please.
Thanks, Mr. Mayor.
Thank you.
Thank you very much, Councillor, and I have Councillor Ferguson next.
Thank you, Mr. Mayor. And I first got to know Donna in my tenure of Hamilton Health Sciences Board for 7 years. Donna was the very capable president of St. Peter's, which was a hospital that came under the HHS wing. But the province picked her away from us, and very rightly so. She's very capable, and we should be very pleased that Donna holds the position of CEO at the LIN. But I'm having the same slides, Donna, that Tom Jackson asked about. And slide 5, we'll start right there. You know, e-health was supposed to be the solution for linking everything together, and that hit the wall.
Right.
And it seemed like it got stuck in the mud. And I know Hamilton Health Sciences was trying to do an electronic connection within the LIN and with Niagara. Is that done? If somebody goes to their family doc and the family doc orders a battery of tests and then refers you to a specialist, when they show up with that specialist, are they going to see those test results, or are they going to ask for them or get them requisitioned all over again?
No, that's the clinical connect that I was referring to the councillor here. Now, I'm making a couple of assumptions by saying, yes, it would work out. It would be that the family doc and the specialist are all have access to clinical connect. So it's been an increasing process to get the physicians all on board, but if the physicians are on board, they have access to all that information.
So it's the physician's decision then whether they want to connect them. It's not mandatory?
Yeah, no, it's not mandatory. No, but to be honest, most of them, the vast majority of them, desperately want it because it really helps them. It makes things easier for them.
Do you have any of your stats of what percentage of the family docs in your LIN
Well,
are
I'll tell you that.
Connect?
Yeah, I can tell you Hamilton may be a little bit easier. It's because of the family health teams in Hamilton, and because the most of the family physicians in Hamilton are linked with the family health teams, and the family health teams cover off about 90-95% of the population in Hamilton.
And 100% of the family health teams are on this?
Oh yeah, the two family health teams are definitely on clinical connect.
Good progress then, because there's a cost involved, but there's also a time delay and the inconvenience to the patient to get these tests repeated at the
that's a huge cost. Exactly.
Repeated at the hospital.
Exactly, and we don't want to encourage that. I'm not going to suggest that everything's perfect yet, because it's not, but we're making progress on that. And to the point of Councillor Jackson, you know, to have to start again on that assessment, that's just wrong. We have to do better. I'm not going to say that that's all finished. We're on the road to improving.
So it sounds like we can put a public check mark against that.
We're trying.
Sorry?
We're trying.
But it's done, isn't it?
Yeah, it is. In Hamilton, for sure it is. And what we continue to work on is, last month we reported to our board that we had hospital lab data in that before, but we didn't have the private lab data. So just last month, the private lab data was in there. So if you go to Life Labs for your lab work, that data has now come in there. So it's a bit of an iterative thing. So the diagnostic imaging now is coming in there. So you build it over time.
Okay, and just to take it one step further, if someone is a Hamiltonian and they're all connected here,
Yep.
but they go for a vacation in Halliburton
Yeah.
and they get sick and show up in a Halliburton hospital, and if their health card is swiped, can they connect to your LIN information up in that LIN?
Not yet, but I can tell you if that person was in Goderich and they had some reason to go to the hospital in Goderich, they could. So we are moving it out, but we're moving it out in the southwest area of the province first. So
LIN's leading this, or is the province leading it?
it's a working together. We're working together
The
on it.
whole eHealth group is not in existence anymore,
No, eHealth Ontario is still there.
are they?
Yeah.
And they're the ones that are sort of leading this province-wide?
Yeah, it is. We do work together with them. They do sit on the provincial groups with us, and then we have our local groups. I mean, Hamilton Health Sciences has, as you well know, with Murray Glendenning, was really the visionary on this, and Murray's now in London. So that has helped us go to the south side, or the southwest area of our province.
Okay, and on the ambulance offloading is a big issue.
I know.
And, it's very expensive to have 6 ambulances sitting at every hospital, but it's also a big risk to the public
Yes,
because
yes.
I think last time I read there's well over 200 code zeros. There's no ambulances available. First question is, you're showing a 19% annual increase in ER visits. With the opening of the urgent care center in West Hamilton, did you not see a big drop after that?
No, interestingly, where we saw the drop was in the CTAS 4s and 5s. So the lower acuities left the emergency department, but they were replaced and augmented by the CTAS 1, 2s, and 3s. And it's hard for us to really understand why that's happened, but it has happened. And that's, you can just, the graph just keeps going up. But it isn't people who ought not to be there. That's the piece that's really an important message. It isn't, before we used to think people went to the emergency department and maybe they didn't need that level of care, but most of these people do need that care.
Interesting. Okay.
Yeah, it's very
It's kind of
interesting.
frustrates you. You invest all that money in
I
an
know.
urgent care center and
Through the chair, Councillor.
Through the chair.
You done?
No.
Go.
One last question through the
Go
chair.
ahead, please.
Is that it sounds like you don't have a solution for the offload problem yet.
The offload problem is a real complicated problem, and so what we're trying to work on is, you could see that, if I go to the, you go to these are just an example of some of the things that we're currently working on to try to keep people home. HealthLinks is another one, and trying to improve the flow through the hospitals so that we feel that we're at least doing everything we can to deal with some of that offload issue, because we do meet as a group with the community paramedicine, the emergency services network we call it, on a regular basis, and try to understand what else can we be doing, what else should we be doing. Working with each of the hospitals to look at their wait times for their emergency department, how quickly are the flow through there, are there best practices from a process perspective. So there's just so many pieces to the puzzle, and we're trying to work at them all to try to make a difference. We've had people come in from other areas. North York has had good outcomes, so we've had them down to see if there's things that we can be doing differently. We've had some lean people coming in to try to see if we can lean the processes better. So there's all kinds of things we're trying to do. So have I got the solution? If we had the silver bullet, we probably would have implemented it, but it's a number of things I think that we need to be able to do.
Because it was frustrating for us in 2006, we put another $7 million into paramedic care. I think it was 60 extra paramedics we hired, because we had a terrible situation on our hands where we had 10 code zeros. And after making that substantial increase in investment, we go from 10 to 200. And so the message here is, don't throw money at this problem because it's not solving it. And so, and it sounds like we're a long ways away yet from solving it. And
slow and steady.
Okay, thank you.
Thank you. Councillor Whitehead and then Councillor Clark.
The two areas I want to focus on, first of all, Donna, welcome to council. And of course, I've known Donna since St. Peter's days. And, wonderful, and congratulations on the appointment on Lynn's, which is later, of course. The question I had, the first area, we might as well dovetail on the offload. Our hospital is a regional healthcare system, correct?
Yes.
Serving 2.5 regionally?
Yes, about that. That's about right, yeah.
So when I talk about offload, I remember going, and some of my colleagues will remember this, with a friend that had a heart attack and waited in emergency. 4 ambulances sitting in the parking lot at the General. They did the critical,
The triage.
the triage.
Yeah.
What happened was we spent 3-4 hours in the merge. I had asked, because I thought the 2-hour was the sort of the target, I had asked the triage nurse, and they said that they had patients flown in from Guelph and Cambridge and London and whatever, and they were all emergency, so they were the regional purpose. So I guess my issue is, if we're truly a regional hospital system, and it's part of the rationale in regards to, utilizing the capacity within the emergency service system, yet Oakville, Guelph, London are not picking up 50% of the ambulance cost in the city of Hamilton. Taxpayers of the city of Hamilton are picking up that additional burden to try and address those issues. Have we talked about how, if it's a regional hospital, that there should be some dialogue and discussions on how they should be contributing to some of the impacts in our own community relative to those costs?
So I'm unaware of how often ambulances would leave Hamilton to go to a different community to bring someone in. So I don't know that. I know that we leave it to the hospitals to make sure that there's the right triaging decisions for the patients that they have. There is a provincial system in place that if a hospital, like we do have a trauma center at the Hamilton General site, and if they've got 2 or 3 traumas coming in and can't take that third one because they don't have the resources or they have too many other acutely ill people waiting, then there is a way of moving that, the next one, if you will, to another trauma center. But I'm sorry, I just don't know how often ambulances would leave the area.
But we do acknowledge there's 2.5 in the regional healthcare system for the hospital system.
Right.
In this day, we had an individual with a heart issue that was flown from Thunder Bay. Okay. Actually, is the other one I failed to mention.
Yeah.
So it was well beyond the regional aspect as well. And again, my concern is, and I don't have a problem with the fact that we're delivering a great service and we're doing it regionally. That's not the issue for me.
Right.
It's always about who should be picking up the tab. Yeah. And when I look at the amount of money, as Councillor Ferguson alluded to, that we've put into the paramedics and additional ambulances and still having the offload issue, at the same time, there doesn't seem to be an acknowledgement, and I don't know if that research or study has been done, that because we're a regional emergency trauma center, especially for head injuries and at General, for example, and heart, that it does have an impact in our emergency department in regards to the capacity.
I see what you're saying.
The City of Hamilton taxpayers are picking up the additional 50% for every dollar or every ambulance we throw at the problem.
I see what you're saying. I'm sorry. I see what you're saying. Yeah. Interesting. I
just want to highlight that, because I think if we truly are a regional hospital system, and if there's a burden that's put on the backs of the property taxpayers in regards to the ambulance system, we need to be thinking about whether or not those other areas that are captured in that regional system should be contributing in some small way towards those kinds of issues, is the point I'm making.
Yeah, thank you. That's an interesting point. Thank you so much.
The other one is, what is it, I know you're doing your very best in regards to the transition, as quick as practical, of getting people out of their beds into homes or long-term facilities.
Yeah.
My understanding is that I don't know what the cost is now, $2,500 a day in those beds?
Oh, that would be high. That might be an ICU bed. Probably an acute care bed probably is around 800 to 1,000.
800 to 1,000, okay. And we know that there's other than those that have homes to go to and family to go to, there's others that are captured where they don't have adequate care or a home to go to.
Right.
And so a lot of times they're waiting for a long-term care facility to open up a bed. So the question I have is, transitionally, have we thought more about the transition? And here's where I'm going. We have 25% vacancy in our RCFs, which provide a certain level of support. We understand, and I understand, that there may be additional services and support that are needed for some of these patients coming out of the hospital beds. And then that's when CACC would obviously be involved.
Yep.
Have we looked at the fact there is some capacity in Hamilton to facilitate those higher costs in the hospital as a transitional piece? And I did have one RCF, we're prepared to be a model, a pilot, to try that process and see if in fact that could offset some of those costs on the hospital system, at the same time providing a high quality care for those people coming out of it as a transition,
Right.
into the long-term care facilities.
Or even maybe transition back home.
Or home.
Right?
Correct.
You're saying RC, what?
Residential care facilities.
Residential care facilities, yes. So in fact, in Hamilton right now, we have a person, Vicki Baird, who's out there working with as many of these places, whether it's housing or retirement homes or residential care facilities, First Place, St. Joe's Villa, trying to see where there's capacity and trying to see how can we augment the services that, because it's already funded, we could put in CCAC services, just exactly what you're saying. I think that that's one of the big answers that we have, because having a person stay in the hospital is not the answer. We do know that we need to get people into the community. Hospitals have become a place that we need them, and they're wonderful when you're acutely ill, but you shouldn't be staying there. We need to get people out of there. So thank you for that. Thank you for that thought, because you're right on the same wavelength as we are.
So and my point is that if there's capacity there, one,
absolutely.
two, they already have a level of support. They're highly regulated by the City of Hamilton.
That's right, they are.
Then what are the barriers to actually utilize that capacity for the purpose of transition, to save taxpayers money, quite frankly, and not sacrifice the quality of care for those individuals?
Absolutely.
So I've been talking about, I know that Dr. Richard knows I've been talking about it, and so does Gillian Henry, that I've been talking about the fact that we need to start thinking outside the box and look at breaking down those silos and see how we can create those linkages.
Absolutely.
So
absolutely.
I want to plug that in as information, and we can probably talk that off record. Thank you
so much.
Thank you, Councillor Clark.
Thank you very much, Mr. Mayor. First, I want to thank Donna for coming today. Donna and I worked at St. Peter's together, and I can tell you that she is an excellent administrator.
Lots of accolades today.
She deserves them, and I understand the province snatching her up. I thought that was a really good decision of them, to be quite candid. I can recall many, many years ago sitting in your office at St. Peter's talking about the continuum of care.
Absolutely.
And many of the things that you talked about today, you had this dream and vision way back then, and you weren't even in this position. So I just think it was a great call by the province. I'm glad to hear that Vicki is working with you also. These are really good things that are going on. So, and I also want to thank you specifically for moving Lynn in the direction that it is going. It has been very positive changes, attitude in how we're dealing with the community and how we're looking at all of the ways that we can assist in the community. So those, your fingerprints were already on it, and thank you very much for that. So on the housing side that Councillor McHattie had mentioned, can I ask, Mr. Mayor, if Ms. Cripps and the Lynn are involved in any way in funding supportive housing for the mentally ill? Because that seems to be, in our community, a significant area of concern.
Yeah, so certainly a significant issue in Hamilton for sure. Yes, we do have some mental health programs, and we work with the city closely on that. Some of that is, there's rent supplements from the Ministry of Health as well. So often in mental health, there's multiple partners that have to come to the table for sure. And that's the opportunity that we have at the Lynn, is to be able to have those multiple partners come to the table and say, let's look at the patient and not look at what our various silos or various funding silos are. Let's see what is right for that person. And we really, I work hard, as do our team, to really always look at the patient, what's best for them, not what's best for the providers necessarily, which can get us into some trouble sometimes.
And I'm happy to hear that, because the real challenge that we have, as you're well aware, is that when we're dealing with mentally ill patients, whether or not they're seriously mentally ill or not, is if they don't get the correct supports when they've been transitioned back into the community, they become homeless.
That's right.
They kind of fall off the grid again, and
And back to
they're
the
not
emergency.
safe, and
That's right.
sometimes the community's not safe. So
That's
it's this cycle, and we can only break that cycle with that support.
Yes.
Where if they're living in an apartment, they have help. When they
That's right.
feel they're slipping, there's help there.
Yeah, there's a fair number of addiction and mental health programs in Hamilton. Fabulous programs, really fabulous programs. I've just been so impressed with them.
So I'm pleased to hear that. I'm hopeful that we'll have additional success stories going on. I know City Housing Hamilton with Councillor McCaddy has been very eager to look
Yeah.
at those
Yeah, I'll follow up
programs
with
and
that.
see how they can work directly with you to ensure that the supports are there for themselves. Land ambulance offload is a significant issue. Many of my colleagues around the table have already raised it with you. Part of the challenge that I'm wrestling with in my mind, and our colleagues are also, is the fact that because of the offload situation we're currently experiencing, in order for us to strategically eliminate that offload, it would mean an investment of 8 to 10 ambulances. We can't afford that. And we're in a situation where, Mr. Mayor, and you know this all too well, the province pays for health care costs at the hospital
Right.
through you fund the hospitals.
That's right.
But on land ambulance, not orange, on land ambulance,
Yeah.
it's a 50-50
That's right.
arrangement with the municipality.
That's right.
So I hate to be a cynic.
Yeah, that's okay.
You know, at times I am cynical. It almost looks like the province is saying, well, we don't have the money to give it to the hospital to fix the problem, so we'll let the municipality deal with it. They can pay for more ambulances. We can put 8 to 10 more ambulances on the road at 50% the cost, which is less than what they'd have to do to fix it at the hospital. So how do we get through to the province that they're putting this burden because of this impasse? And I know we've done all of these things, but many of these things are already in play. Some have been in play for a couple of years now.
It's true.
The numbers are not going down. The
They're
trend is
not.
going up.
You're right.
Thank you. Sorry about that. Many of these things are already in play and have been for a couple of years. The trend is still going up. How do we get the province, the Minister of Health now, the new minister, to understand that this is a real fiscal challenge for the municipality? And I know you don't have the funds to just cough over the money to the hospital because your budget's provided to you by the province. So
Right.
you know them better than us. We don't meet with them that often. Perhaps you don't either. I don't know, but I'm going to rely on your expertise. What should we do?
Well, I'll tell you. I can't tell you what to do. You can figure that out, I'm sure. But one of the things that we consider as we come out and do speaking engagements like this is our opportunity to say, we have been out. So when we go back to the ministry and have our conversations with them, we say, we were meeting with the City of Hamilton, and here's their issue, here's their pressures, and I'm quite prepared to put this as a high pressure for our community because it is a significant issue for us, and I will certainly commit to you to do that.
And if you could add, Mr. Mayor, when you're talking to them, and I think it's important that the ministry understand this, or the minister understand this, and she may not have just looked at it from this perspective. Sorry. Yes. If we all have different duties of care, the City of Hamilton has a duty of care in law with the ambulance.
Absolutely.
Hospital has a duty of care with each patient that's now in their care. Long-term care facility has a duty of care, and you know where I'm going with this. So if we have all of these ambulances lined up outside of a hospital because they're caught in an offload, and we don't have an ambulance available, and mutual aid doesn't kick in because they don't have ambulances available, there's going to be a significant liability and risk, not to mention a potential death because we didn't have an ambulance on the road. That's our duty of care.
Absolutely.
So for us to deal with that duty of care, we have to invest millions of dollars in brand new equipment and we're not getting the help
Yeah.
from the province.
Thank
We
you.
have to
Thank you for
argue
that.
to them to help pay for those 50%. So they need to understand the situation that we're in.
Yep.
So if
Thank
could
you.
Please
Thank you.
share that with the minister. That would be most helpful to us, Mr. Mayor, I believe. And again, I am pleased that you're there, celebrated when I heard it, and look forward to working.
Thank you so much, Councillor.
Thank you. Councillor, would you take the chair as Deputy Mayor, please?
Yes, sir.
Donna, I don't access the healthcare system very much. Years ago, I read a statistic that people who have annual checkups die within a year of an annual checkup.
Oh, okay.
Figuring out which annual checkup is going to be the bad one. So anyway, so I had a situation where being in the swimming pool got my ears all plugged up, and I couldn't hear a thing. And I had a choice of trying to make an appointment or going to the emergency, and I had this walk-in clinic thing on in our mailbox. So I walked over to the Medical Arts Building, handed it my health card, and 20 minutes later I walked out with my ears all blinking.
Good.
And I think the point that I'm trying to get to is I hope that you have enough enjoyment out of what you're doing in the field that you're doing it, because so many good things happen, and we are so well served in terms of healthcare. Naturally, we're here to try to overcome the problems that have been outlined so well by those around the table. But every now and then you got to think, boy, we're doing a pretty good job delivering health care. Is that fair to say that you do have nice evenings sometimes? What do you think about what
We have lots of good evenings. But you know, we're so fortunate in Hamilton to have the best providers. I have to tell you, since I've taken this role, I get to see providers across the province, and there's no health service providers like the ones that we have in Hamilton. We're really, really very fortunate. And to your point, we are very lucky to have them here.
Well, I believe we are, and that's one of the things that I would hope that the Economic Development Department eventually messages out, because we hear about retiring in Elliott Lake, and the older you get and the more concerns you have about your health, the proximity to first-class health care would seem to me to be a magnet.
So true.
So thank you for that. I have no other speakers, so I'll ask for a motion to receive the presentation. Councillor Ferguson, Councillor Pearson, all in favor? Thank you very much. Thanks for your presentation. That 1 year got you, didn't it? Everybody dies within a year of an annual health check. All right. We have our 5 delegations approved now. So we go to consent items, and I need a motion to receive the minutes of the Community Food Security Stakeholder Advisory Committee. Motion for that, please. Councillor McCaddy, Councillor Morrow, all in favor? Thank you. That's carried. Public hearings. And I'm going to call upon David Carson now to speak to the impacts of climate change. Mr. Carson, would you please come forward? Podium is yours. Please go ahead. We normally have a 5-minute limit on public presentations, but go ahead.
Mr. Mayor, councillors, thank you very much for hearing me today. I'm involved in a number of groups in the community with a main emphasis on resilience and sustainability for the community. And today I want to talk about one of those groups that I'm involved with. I'm a member of Clean Air Hamilton, specifically with respect to working on their climate change task force. Almost 3 years ago, this council was the first municipality in Ontario to sign a climate action charter. And that charter contained 2 sections, a section on facts and a section on commitments that the city would make and the community would make. Nothing has changed with respect to those basic facts on climate change in the past 3 years. In fact, they've become more certain, with greatly increased scientific attention being paid. But I believe we can and must do more with respect to our commitments, and I'm here to ask you to raise the bar in your leadership of the community in taking action on climate change. We now know that it's too late to prevent many of the observed and predicted effects on climate change. The carbon we've already released into the atmosphere is going to be there for 100 years or more, and we haven't stopped releasing it. Getting ready for the increased impacts of climate is essential to the well-being of our community. Impacts that include many days of more extreme heat, more intense rainfall, more vector-borne diseases, and higher average temperatures. Right now, we're prepared for the climate we used to live in, not the one in which we will be living in. This is where the city needs to act and the community. And as civic leaders, you've got a very difficult job, because many of the costs are short-term, but the benefits will be more medium-term. But making difficult choices and hard decisions about how to balance the needs of the present with those of the future is exactly what leadership is about. We know that other levels of government, nationally and internationally, also have big responsibilities with respect to act on climate change. But for the residents of this city, Hamilton is the local and personal impacts that will count. This map was from a recent Natural Resources Canada report, and it illustrates losses across Canada from extreme weather. And it's just a matter of time before Hamilton gets hit with another of these events. We've already had our share of some. And this picture shows that it's not only city-managed assets that are vulnerable, but all the community assets as well. Just the example of Toronto in there, which I've put the red arrow to. Last year, the July storm caused expenditures and revenue loss to the city and the Conservation Authority of Toronto of $70 million. But you'll see that the total insured losses there were over $850 million. So the business and personal losses were 10 times, more than 10 times, what the city and conservation losses were. And those don't include the uninsured losses. So we can see that directly and indirectly, climate change is going to cost the citizens of Hamilton money, one way or the other. The question we have to ask is how much will be reaction and recovery, and how much will be preparation and prevention? And I'm asking you to step up the level of city investment in climate change readiness. I'm asking you to assign more resources to planning and preparation. Currently, the city's got an excellent air quality and climate change coordinator in public health, but part-time coordination on climate change cannot do justice to the required work. A community climate action plan has been initiated. In fact, work just started this week. But I don't believe this will bring to bear the full resources of the city. I want to show you the example, a recent example, just this week, of the City of Toronto in establishing a climate change risk management policy led by the city manager with the attendant resources to implement it. This is, I'm just going to show you on the chart here, 4 parts of their policy that they've just passed this week after much debate. One was to establish and adopt the climate change risk management policy, which establishes processes, controls for systematically identifying, assessing and taking action arising from a changing climate, and defines those roles and responsibilities. And clearly it's much broader than just public health. It requires, the second point requires all agencies and all city corporations to adopt the city's climate change policy. So reaching out to people like City Housing, other organisations that are part of the city. The last presenter talked about, and you questioned them about, the responsibility of the province versus the city to pick up certain issues. And we've got to keep on pressing the province, as this City of Toronto policy does, to prioritise the health and safety of residents with attention to the particular needs of large cities as a result of their density and the age of the infrastructure and the need for intergovernmental coordination. And the fourth point, and this is not the whole of the policy, was to direct the Chief Corporate Officer, or in our terms it would be the City Manager, to establish a process to manage across city divisions the interdependencies of infrastructure and services, so all departments work together and filter their decisions through the lens of what climate change is happening. I know the City is involved in piloting a municipal risk assessment tool, but a tool is not the same thing as having a solid policy with an integrated process across all departments. Now, I said at the beginning Hamilton was a leader in the province in signing a climate charter, and last year the Board of Health actually took the lead to pass this resolution, that the City Manager's Office, with support, and it listed all the departments, form a working group to undertake a climate change vulnerability study and risk assessment and report back. I don't believe this recommendation has been acted on. If undertaken, it should provide a trigger for more action. Once we understand the risks better, I'm sure action would be forthcoming. I ask that the Board of Health reaffirm this recommendation from their report of last year and ask staff to act upon it. And if you use the Toronto policy as a starting point, I'm sure it will save a lot of staff time and money. So I want to close by asking again for strong leadership of this Council and the next, on which many of you will no doubt serve, on preparing for the impacts of climate change. Do a thorough job of establishing a policy on climate change risk assessment, and then apply a strong climate risk lens to your major decisions in infrastructure renewal, in emergency planning, in public health, in transit, in energy conservation. And these efforts will truly be an investment, as it's clear that failure to adapt to the impacts of climate change will have very costly consequences. Understanding and assessing the risks is the first step to justifying the priorities and expenditures that we need to make to prepare. Thank you.
Thank you very much, Mr. Carson. I have a couple of speakers, Councillor McCaddy and Councillor Jackson. Councillor McCaddy.
Thanks very much, Mr. Mayor. Thanks very much, Dave, for coming in front of us again. And Mr. Mayor, I did take note of the Toronto policy change that came out a couple of weeks ago, and they are leading on this, and they have been doing that for a number of years. They've been doing a good job on climate change, and now stepping into the risk area in particular. I think you're quite right on this last item that the working group has not been established. I checked that before the meeting today, and it has not been established yet, so I guess we can, I don't think, Mr. Mayor, we necessarily need a motion on that, but I would just ask Chris, I don't see Chris Murray here at the moment, but if we can ask Dr. Richardson perhaps to check in with Chris on establishing this office. I think that has to, or the working group that's talked about here, that needs to happen. Because climate change is one of those issues that works across all the departments and, beyond the city, of course, to the province, the feds, and the conservation authorities as well. So that definitely needs to happen, and it should happen soon. Next week, Mr. Mayor, we're going out to the community to begin the community climate change plan development process, working with Laura and others on that. So we need to say we've got our own house in order as we ask folks in the community to take leadership on climate change. So I don't think you get any argument from us, David, that this is a priority. And I know our staff lead on this, Brian Montgomery, understands this well, and he's been following the work in Toronto very, very closely. There's funding, I think, that the city's applying through FCM, and we'll ask Councillor Duvall to watch that for us for the community plan, the community climate change plan, the green municipal funds I think Brian's got the lead on that, as I understand it. I'm not sure where that application is in the process. And there was a resiliency officer that the Rockefeller Foundation was supporting, and they've supported about 22 municipalities now, I think, throughout North America. And we had applied. I don't think we were successful, and I think we have an opportunity to reapply. So I'm hoping maybe we can hear back from Chris Murray or Dr. Richardson as to what's going on with that, because that sounded like an intriguing source of funding to set up a resiliency officer, which would get at the risk management issues that you're bringing before us today, David. So I think we understand the issue. The Conservation Authority, as you know, is going through some modeling work, working with McMaster to better understand the impacts. So we've got work to do, and I think your comments today are bang on.
Thank you.
Thanks, Mr. Mayor.
Thanks. I appreciate waiting for the city manager to be present for the conversation, because I think in fairness, he would have to bring forward a report as to what a useful working group would involve in terms of staff time and so on. So that's fair, and I appreciate that. I have Councillor Jackson and Councillor Whitehead. Councillor Jackson.
Yeah, thanks, Mr. Mayor. And I was just going to agree with your direction there, but also, I guess, through Dr. Richardson. I mean, David's appeared. I think this isn't the first time, David. I recall you've appeared before Board of Health, and it's good to see you back. So I would hope through Dr. Richardson, after this meeting, she would get in contact with the city manager if he's tied up with other things to find out the status of this resolution. Just a question, Mr. Mayor, through you to David. David, you know, it just seems that this seems very motherhood, and obviously just look at what's going on in Saskatchewan, Manitoba recently, the Assiniboine River and everything. I'm just, you know, I'm fascinated by it all, and obviously something's happening out there, and I'm being dragged along, but I'm open-minded, because I realize Suzuki was onto something 30 years ago, and so here I am now listening more to him, to stuff like this. But I find that if there's a downside to doing risk assessment of services that may cost taxpayers more potentially upfront, or there's a change in policy like wind turbines to do what seems to be motherhood the right thing to do from energy standpoint, there's an aspect of society that pushes back or says, don't put me out of the reach of affordability in terms of higher hydro rates or whatever the case might be. So, Mr. Mayor, just through to David, you seem very knowledgeable in this, David, just maybe a comment on some of the pushback that seems to occur, though, for those of us that are in elected office from our constituents when we have this kind of policy change. Just a thought on that?
There's always going to be pushback from some people because it affects them. I think we have to get over the NIMBY piece if we're going to put in place good solutions. And that's very hard when you're talking one-on-one to an individual, but at some point we have to look at the broader community good. That's what the decision-making is all about.
Appreciate that, Dave. So, Mr. Mayor, I think between Dr. Richardson and the city manager at this table, since it's come through here, we need to find out where that working group stands, like you said. Thank you very much.
Yeah, it was my understanding, Mr. Mayor, when I moved a motion a number of years ago when we had the major floods, I believe in Councillor Marilla's ward and my ward, where they were using canoes to get from house to house, that we needed to do something that was independent from just what staff does. So we created an independent panel of experts, and we had climatologists and storm management experts and et cetera. And their discussion was what was happening with the change in climate and the change in the type of frequency of storms and the veracity of the storms and et cetera. So I'm just wondering, a lot of work has already been done. We also have another division that is doing everything they can for energy efficiency and so forth, that have done a very good job. I guess my only concern is, are we duplicating things that are being done?
I don't know whether there's duplication, but there's certainly many items which other municipalities have identified will help in this process, which we could take. Toronto's just started local improvement charges to support energy efficiency, for example. Changing building regulations to move people towards more high-efficiency homes or net zero homes. There's many things like that that affect either local regulations or provincial regulations that we can push for and can change directly. I don't believe that's duplication. I think that's more work needs to be done.
So have you got a general working knowledge of what the city's already doing on those fronts?
I'm aware that there's a discussion on local improvement charges going on in the city manager's office. It hasn't yet reached this point. I'm aware that there's an energy efficiency office, obviously, within the city. I'm consulting with Brian Montgomery on some of these other activities.
So it's basically having a central group that not only looks at what's already being done, but what more can be done to address the vulnerability and risk.
I think that the issue is that if you get silo decisions, then you're sub-optimizing what needs to be done. So, for example, a planning requirement might be that if you're looking at a new subdivision, the roads ought to be aligned east-west so you can put solar panels on the majority of the roof as time goes by. They're facing the right way. Those sorts of things need introducing the climate issue into other people's work.
Thank you.
That's just an example.
I have myself on the speakers list, and I have Councillor Clark next. So, Mr. Carson, this is a two-sided issue. One is what nature's doing, and the other one is what man's doing. And there was a remarkable article on the Winnipeg, Manitoba, the Manitoba floods, which showed the loss of these dimples of land all over the place as farmers drained areas and flattened them out to have better crop surface. And when you take 5,000 dimples that would have collected the water, and now they just run off. They used some numbers that were astounding, that the flood level of the Assiniboine wouldn't be anywhere near what it was. So we're blaming the heavy rains that we don't seem to have seen before. But on the other hand, we're taking away permeable surface and so on. So from your perspective, through you, Deputy Mayor, how important are our actions, and are they cataloged to a useful extent by the scientists in terms of what we're doing to ourselves, never mind what nature is doing?
I think it's clear that the scientists have identified that we're the predominant cause of climate change through burning fossil fuels. That, to reduce that or to mitigate the future impact would be by cutting back on fossil fuels. The problem is that the amount that's already up there is already going to cause us problems, and we need to adapt to that. We need to be able to handle more intense storms, more flooding in the city. So we've done stuff to ourselves. We should try and avoid continuing to do that, both on the fossil fuel side, but also on things like the amount of permeable or impermeable surface we put in place, the amount of extra roads we build, the amount of extra cars we put on the road. Those are all future actions that we've got strategies through transit, for example, to try and reduce those future impacts.
Okay, so through Mr. Chair, my concern is that the motion that we wish to have reinstated, and I don't disagree with that, but such a complex issue. I'm not sure what a working group out of Hamilton could provide beyond what scientists all over the world are providing us now. So what would you say is the usefulness from a city of Hamilton point of view of this?
The scientists are telling us what the problem is, but there are many groups, for example, the Local Government for Sustainability, of which Hamilton's ICLEI, of which Hamilton is a member, is helping to provide solutions as to what we can do to adapt our cities from the damage that's already happening, and is likely to happen in the future. So there are very many specific programs that we could put in place in the city to reduce the amount of future damage or to reduce the impact on our residents in the future.
Thanks.
That's what the city manager should be planning for.
I'll take the chair back, and Councillor Clark, you're on the list.
Thank you, Mr. Mayor. And just to that last point, because when I read components to it. There's the climate change vulnerability. What are we doing to add to the climate change? But I took from this the more important component in my mind was the risk assessment of services and operations. So I think it's very justifiable for us to try and examine how we are preparing and what we can do to mitigate as a result of the increase in rain that we're experiencing. Right. Likewise, wind. We've had some significant windstorms that we didn't have in the past. And even if there's an argument in our community whether or not that storm was climate change or that storm was just another bad storm, it still hit our community. So to prepare for that, I think, is a valid component, and that's a significant part of this recommendation, correct?
I believe so, yes.
Yeah, so I'm still very much supportive of it. I'm not sure exactly where it is. We'll have to hear back from the city manager, but we do have the ways to start to mitigate, and we have started to already with some of our actions within the city regarding flooding, but I'm sure there's more that we can do. So thank you.
Thank you very much. So with the board's permission, I would suggest that Dr. Richardson discuss with Mr. Murray the disposition of the motion that's before us. With that?
Through you, Mr. Mayor, I know that Mike Kakopoulos was here initially to give us an update on that, but unfortunately he's had to leave. So I'll ask Mr. Murray to send something by email.
So a motion to receive the delegation, Pearson, Partridge, all in favor? Carried. Thank you very much. Good conversation. And now I'd like to call on Don McLean to speak to the annual report of Clean Air Hamilton. Welcome, Don.
Now I'm going to figure out how this works here. Can you help me, Jasmine, just to get back to the that's it. And then I'm moving it forward with that. Okay, good. Sorry for my technological limitations here. Thanks very much to Mr. Mayor and other members of the Board of Health. I started off this presentation just with this little reminder. April this year tied the record for the hottest April on record. These records go back to the 1800s, and May exceeded it. So even though our temperatures have been up and down on a global scale, there's no question that we have a very hot year already in progress, and likely going to be one of the hottest on record. I know you're busy folks, and the Clean Air Hamilton report that you have in front of you is 165 pages or something like that. So I'm not sure that you're going to be able to get a chance to get through it or have had a chance to get through it in detail. I wanted to draw your attention, like the previous speaker, to the aspect of the report that addresses climate change. That starts on page 49. It's about 18 pages. It is just barely touched upon in the staff overview report that I'm sure all of you have had a chance to look at. So the overview says that Clean Air Hamilton has begun to examine the climate change issue, and it hopes to encourage for more greenhouse gas reductions and consider the implications and risks of climate change to improve the quality of life in Hamilton through climate adaptation policies and planning, and I want to speak to some of that. The full CAH report includes some quite stark warnings, these are a couple of them from the Intergovernmental Panel on Climate Change, the World Authority on this issue, that the impacts of climate change will be severe. And it notes that in Hamilton, potential impacts include extreme weather events, flooding, droughts, increased temperatures leading to increased health risks and financial costs. So this certainly moves into the gamut of the Board of Health, but overall, the tasks that council faces generally. And in the last 8 years, the city has endured, according to this Cleaner Hamilton report, 17 rainstorms. I think if we went back a couple of years additional to the 2004-2005 storms, we're probably up in the range of 20. And at least 6 of those appear to have exceeded the once in a 50-year standard. Certainly the one in July 2009 that initially flooded the Parkway and 7,000 homes was a 100-year plus deluge, and that caused, according to the report that Hamilton put into the province seeking assistance on that, about $300 million in insured losses alone. This trend is not surprising. This is a map from the National Academy of Sciences report in the United States. It came out in May, got quite a lot of publicity, quite a lot of attention, that elaborated and made clear the kinds of things the Americans are facing, and clearly we're facing as well. And this shows the increase percent changes in the amount of precipitation falling in very heavy rain events, the heaviest 1%, from 1958 to 2012 for each region of the United States. And you can see that the one which has had the most dramatic increase is the one that's right next to us. 71% increase in the Northwest. And the second highest is the one that's second closest to us, which is the 37% increase covering Michigan and Minnesota and Illinois and so on. So that trend, while that only covers the U.S., where the map only covers the U.S., you can see that it has implications clearly for us. Toronto's superstorm a year ago this week generated nearly $1 billion in insurance claims and cost the city government $70 million, as Mr. Carson pointed out. That dumped about 126 millimeters of rain on parts of the city. That's about 25% more than we got in the 2009 storm that flooded 7,000 homes in Hamilton. Just as a comparison, just 2 weeks ago, there was another dump in Toronto of 50 millimeters in an hour that flooded the Don Valley Parkway, the Bayview Extension, number of other facilities. So we're watching the flood damage climb right now in Manitoba, as Councillor Jackson was pointing out, and the local weather patterns, I'm sure, have many of you expecting constituent calls about flooding, because every time we turn around, there's another severe thunderstorm watch in Hamilton. So there's no question that Hamilton is going to get hit again, and that it will be worse than what we've seen. Indeed, we've already had a much worse storm than Toronto's July 2013 flood, the $1 billion one. And you may remember this. I'm sure Councillor Clark remembers it, and Councillor Johnson isn't here but would remember it as well. This was our flood out in Binbrook. It didn't flood as many homes because there weren't as many homes in its path, but its actual amount, the size of it, was greater, substantially greater than what hit Toronto last July. This is from Hazel Brettons at the Conservation Authority, the presentation she made to the LeTourneau Conference last fall. And if you look at those red squares, and I hope those numbers are visible to you, but there is one of them that is 184 millimeters, and basically that happened in 3 hours. So we got over 6 inches of rain in 3 hours. That's over 7 inches of rain in 3 hours in some parts of the municipality in that storm. We were very fortunate, not those who got hit by it, but we were very fortunate that this storm wasn't a couple of kilometers further north. If it was, we would be the poster child for extreme weather in Canada, not Calgary and not Toronto. So the damage obviously would have been far worse. What would I like you to do? This is the 2009 storm, and you can see the numbers there, and we hit a small pocket that hit over 100 millimeters of rain, again over a very short period of time, a 3-hour period largely. So Mr. Carson, I should have worked more closely with him to see what he was going to do, but he raised this element from the last report that came out of the last Clean Air Hamilton report and the decision that was made. I don't need to focus on that. That's the highlighted area, and you've seen that from his. That's the decision that a number of you have spoken about. So the actions that I think you need to take in particular, so that first one is the minimum first step to implement the decision you've already made. Second one is to ensure that you have adequate dedicated staffing. We have less than half a position dedicated to climate change issues in the city at this point. It's a wonderful half, and lots of praise for Brian Montgomery, but in addition to being the climate change coordinator, he's also the air quality coordinator, and there are certainly links to that. And he's also the one responsible for putting together the Upwind Downwind Conference. So this is not adequate staffing to do the kind of tasks that we're facing in the city. A third thing that I think you need to do as a priority, and this goes to Councillor Jackson's comment about feedback and backlash, is we need to actually do what Toronto did and what Durham Region has done, and that is get a study in place that shows what is very likely to happen as the climate warms. What the reports that were done by consultant, Senes Consultants for Toronto and Durham focused on was the period 2040 to 2049, and the numbers are quite shocking, both in terms of increases in precipitation events, heavy precipitation events that I've been talking about, but also increases in the numbers of days over 30 degrees, the numbers of days where the effective temperature is over 35 or over 40, the kinds of things that we call heat alerts for. So having that information worked out for Hamilton and can now be done with the climate modeling that's in place now would be very helpful to making clear to those who may have some doubts about spending money on this why it's necessary to do so and why it's critical that we take action. An additional step is I think you need to make climate change a required part of all your decision making. So for example, I had a look at we're in the process of building an extension, the Trinity Church Road extension, which I believe has been renamed the Red Hill Parkway North or something. Upper, okay. There was an environmental assessment done for it. There is no mention of climate in there. There is no mention of warming. There's no mention of impervious surfaces except to the effect that we're not going to do much, we don't think we're going to do too much damage to the streams that might be affected, Hannon Creek and others. We're simply not considering what the future is going to be, what we know the future is going to be in the planning we're doing right now. And we need to be doing that as a priority. We need to be doing it in all our activities. And we need to engage all our staff in this problem. And one of the aspects of that was also mentioned by Mr. Carson, the steps that were taken in Toronto in the resilience report, where they had all their staff in the last year have gone through at least a half-day workshop on what can be done in their departments in terms of vulnerabilities and how they can adjust and adapt to those. So those are the points that I wanted to make to you today, and pay attention to the good advice in the Clean Air Hamilton report. Thanks very much.
Thank you, Don. And seeing no speakers, I'd like to receive Partridge. All in favor? Thank you very much. I'm going to now call on Dr. Jim Quinn to present Respecting Climate Change Mitigation and Adaptation. And I'll ask the Deputy Mayor to take the chair briefly.
Good afternoon, Doctor. Please proceed.
Thank you very much. I appreciate the opportunity to speak to all of you. Before I get started, I just thought I would mention something about all of us as humans who evolved like other species to be generally short-sighted. And I'm going to be focusing primarily on the mitigation part of this split. And I thought I'd start with a short story. I'm going to have to run away quite soon because I have to go and pick up a porch railing that is being powder coated in the East End. The reason I have to run away and do this now is because I didn't have the long view of this porch railing. I saw it starting to get rusty many years ago, and I didn't clean it up. I didn't brush it. I didn't repaint it. I let it go. I let it go to the point where my neighbor pointed out that if a child nearby comes to visit, sticks his finger in between where the welds have gone, and someone leans on it, he'd lose a finger. So now I'm faced with cutting the railing off, taking it, re-welding it, sandblasting it, taking it off for galvanizing, and then powder coating. So a lot of work that I have to do now. In a similar way, when we think about health, and we're at a Board of Health meeting right now, I'm not going to belabor this point right now, but in this particular paper it talks about, this is by Ron Gotzel, do prevention or treatment services save money? The wrong debate. The reason this is considered the wrong debate is because in this paper they're talking about prevention, not in terms of prevention long term, but more in terms of identifying people early on that have disorders and have diseases, and then treating them very quickly. And in that case, the savings of money is not clear. However, if you think about dealing with healthcare from the perspective of lifestyle changes in perspective of the environment and so on, then this goes the other way, and there's lots of money to be saved by prevention of the need to cure diseases. And this is something that, of course, in my field, in research, we don't see many research dollars directed at trying to prevent this. We see research dollars directed at cures. So we wait until things are acute before we take action generally. Now this is a message that was present a long time ago, and the response of many people in the public to this kind of a message was this one, that we environmentalists were reactionary, that the sky was falling, there was nothing to this. Nowadays, now that we've got enough evidence out there and people are starting to pay attention, this is the reaction of the public, basically. It's climate change is happening and it was caused by us. Tell me something I don't know. Okay, so before we were sort of outcasts, now it's like we're old news. Okay, well, here's the basis for our recognition that climate change is happening and we've caused it. The blue ribbon represents the predictions of climate change models that are based only on nature, not on anthropogenic contributions, not on anthropogenic forcings. The green ribbon represents predictions of models that include anthropogenic forcings, and the red line represents what's actually happening in terms of changing of the temperature. And we've recognized this for some time now with the IPCC report that came out most recently, number 5. We've been able to get more accurate with these models, and now we can look at various continents, and we see the same general pattern. The blue lines, again, are only natural forcings. The pink ribbons represent models that include anthropogenic forcings, and the black line is what's happening in reality. So, as near as science can get to proving something, and we can't prove anything, there will always be doubt. So the IPCC report refers to things being very likely. This is tantamount to being as true as we can make them. Beyond just the climate change, we know these are lines that go over the time frame that is climate change. That is 30 years. 30 years of climate is climate and not weather. And these patterns indicate an increase in various severe weather events, floods being the top one, followed by extreme temperature, storms, etc. So we know that these extreme weather events are increasing, and our response naturally to these acute problems is to say, we've got flooding in Hamilton. We have to deal with this. We have to adapt to this new climate. So in this particular figure, we see the route that this follows where climate change, including variability, is affected by humans, their impacts and vulnerabilities caused by humans. And all of this amounts to policy responses that go one direction, in this case to the right, adaptation. And mostly what we've been talking about here today has been adaptation. And that's dealing with the acute problem, the flooding and so on that's happening now. And that's something that has to be dealt with clearly. However, the left side of this model, the mitigation, is something that goes by the wayside to a great extent. And that's something that we really, really need to be paying attention to, because in the future, that porch railing is going to rust out and you're going to have to cut it off and take it to the sandblaster. So what we see when we look at various guidelines for changes that are proposed by various levels of government is this is a federal response. The only one I could find was specific to Nova Scotia, it turned out. But when I looked at this response, what I found was that if you counted it up, there were 15 pages dedicated to adaptation and 2 watery pages on mitigation. Now, the mitigation part of it, it's not surprising with our federal government with its focus and interest on tar sands oil that they're not going to worry very much about mitigation. They're thinking all we have to do is adapt to this because, by God, we need our oil. If we look at this is a little worksheet that they proposed, and what you see, obviously you can't read this, but these are all items that pertain to adaptation. So here's what you need to do for adaptation, and you'll see in a moment up in the upper right, that is the sum total of what you need for mitigation. So the feds have come up very short. Now, I would argue that the province has done a much better job on focusing on adaptation, and this is a document that's online, and I think it would be well worth looking at. There are a number of items on here. I'm not going to go through them other than to put up these issues that they cover in that particular document. And I'm not going to read these over. These are items that many of us have thought a lot about relating to city boundaries and various other things, zoning bylaws and so on, that we should be paying a lot of attention to. And I would recommend having a look at this document. I think it's well worthwhile. And I would like to also point out that in 2006, the City of Hamilton had this document put forward and commissioned, and I don't know what's been done with it, but I thought I would leave with the last paragraph in this document, because I think it's pertinent to this meeting, particularly given that this is a Board of Health meeting, in that the author concludes that there are profound policy implications of recognizing that many climate change mitigation measures provide substantial local health and environmental benefits. Recommendations out of this process include the full analysis of costs and co-benefits by building health impact and environmental impact cost assessments into analyses of alternatives. I won't read the whole thing, but the bottom line is that we need to be increasing our focus that improve energy efficiency, reduce fuel use, and so on. And I recognize that the City of Hamilton is doing some of these things, but there are a number of other things that I think we need to be paying attention to and doing with the long view in mind. We have to be thinking about trying to resolve these issues before they come back in force, causing us much worse problems in the future. Thanks very much.
Thank you very much, Doctor. Did you have a copy of your presentation so we've got that coming to us? Excellent. Thank you very much. Any questions? None. I need a motion to receive the presentation. Moved by Councillor Pursuta, second by Councillor Pearson. All those in favor? Carried. Thank you very much for attending today. Next on our list is a Robert Clark, Port Fuels and Materials Incorporated. Mr. Clark is no relation to me. Yes, Councillor.
Yes, Mr. Chairman. Very pleased that Mr. Clark can be here today. His correct title is Admiral Clark. He's an American retired member of the U.S. Navy, and a very distinguished one. And as part of an ongoing series of meetings, he and others met with the Keith Hub in my ward some weeks ago, and and I was able to attend myself. And there's a meeting for anyone interested, July 16th, 7 p.m. at 270 Sherman North.
Yes.
Of the Sherman Hub, and Admiral Clark has arranged to be there as well, and that all helps in the discussion. There are different points of view, as one might expect. I will again table my motion that is later on in the agenda, and I also have a series of questions from that I want to give to Mr. Clark from Dr. Linda Lukasik, Environment Hamilton, and I have copies available for any council members who want to review that as well. But I think this discussion only helps, and I believe you're open for questions, and I wanted to commend them for retaining Larry Deanne, former mayor. That helps understand how City Hall works from a point of view of a company where the head man comes from Pittsburgh, isn't totally familiar with how we do things. Also, the relationship with the community groups, which for me as the representative of Ward 3 is very important as well. And
I'm sure Mr. Deanne is registered voluntarily as a lobbyist.
He doesn't have to yet, but perhaps that will be happening. I think everyone knows that he does that. So I'm very pleased that this can take place.
Thank you very much, Councillor. So look forward to the tabling of the motion. We'll proceed with your presentation, and I'm sure you'll have a few questions from around the chambers. Welcome to Hamilton.
Thank you very much. Deputy Mayor, council members, Board of Health, thank you again. As Councilor Morrow has mentioned, we really would like to come and introduce our
microphone a little bit closer.
We really would like to introduce ourselves to the council, the Board of Health, let you know who we are, what we're in the process of trying to do, and give you a status report. This is non-scientific. It's a general update so that you can be generally aware. There are studies that are ongoing that I'll mention. When we have all of the data together and it's gone through the Ministry of Environment and Climate Change, we'll be able to come back and present you finished products. And we'll plan on doing that. As mentioned, I'm Bob Clark, but to the left of me is Ian Hamilton. Ian Hamilton is Vice President of Hamilton Port Authority, the location for where we are planning our proposed facility. So both of us will be available for questions. Leverage Green Energy is a private equity fund. It's a U.S.-based private equity fund that searches the world globally for technologies, environmental technologies that we believe fits the definition of SRI, socially responsible investment, to be able to bring the best of global technologies into use in a business environment to transition into the green technology world. The major investors are Scandinavian pension funds, banks, and private funds. Port Fuels and Materials Services is the local Canadian company that is proposing to do the gasification facility on the Port 15 plot of land on Hamilton Port Authority. The handout that I have and I've distributed is only 6 pages long, and the intent really is that you have something that you can retain afterwards rather than to read and to go through it. As I mentioned, it's not a technical presentation. We have a gasification facility based on novel technology, but proven technology that's used in a different application than it's ever been used before, that generates the highest mass and energy balances, meaning that it has the most flexibility of any existing system and creates the most amount of energy. Pure and simple. It has the ability of processing any organic component and transforming it through the gasification process and the cleaning of the plasma converter into energy. From a local solutions standpoint, we've been working with Hamilton Port Authority for a number of different reasons, one of which is a good transportation hub. It has land available, it has rail, it has truck, it has sea, it has access, and listening to Clean Air Hamilton and listening to Environment Hamilton, because we've met with Dr. Lukasik earlier, our goal is to treat the source, or treat the material as close to the source as possible so that the waste, which we consider to be a fuel, is located in and around the Hamilton Port area. We're bringing a large capital investment. We're bringing numerous construction and operation opportunities. We're bringing ongoing maintenance, service, operation facilities to the area. I've noticed that, and also taxation for the city as far as that's concerned. If I could just give a quick glance, this is what I refer to as the management tool. In simplified symbology, it shows on the left-hand side that there's various types of waste streams that can be processed. And if it has an organic component to it, that means it'll have a calorific value that will be able to transform into energy. The proprietary aspect and the development of the technology that we looked for is the gasification and plasma cleaning in this particular scenario. And this is the heart of the proprietary technology that allows it to operate in the most efficient fashion of any known technology today. Using the words organic and inorganic, organic simply is something that you can turn into energy. Inorganic material are things like soil that have no value. They are vitrified and turned into a commercial product called plasma rock. It's a completely closed loop system. There's major distinctions there. And then the various products that it can be created from the synthetic gas that is produced is electricity, heat, solid oxide fuels, gas to liquids, hydrogen. It's a very capable system. But to the heart of it, skipping the technology and skipping the plant itself, where are we? And the purpose for my being here, Mr. Mayor, is the status of where we are today. We started about our first meetings with the Ministry of Environment and Climate Change was January 2013 at the provincial level. Since then, we've had meetings with the ministry at the local level and meetings with other government officials. Mr. Mayor, thank you again for kicking off our conference at McMaster University last September. We co-sponsored an energy conference in which we first introduced this type of technology to a global group of experts, energy experts in green experts in green technology, and we co-sponsored that with McMaster University, and we have many, many other opportunities with McMaster we'll talk about a little bit later. We published the official notice of commencement on the 3rd of April, which is a formal letter that we've sent to the Ministry of Environment to notify them of our intention officially, in addition to all of the other discussions we've had with them. On the 16th of April, we received the approval acceptance letter back from the Ministry of Environment. On the 17th, we had the open house, what we refer to as an open house. And the entire purpose of an open house is to introduce ourselves to the locals or to whoever we can meet with and say, this is the start of a process. This is the start of an environmental permitting process that we're working with the ministry. It's the first of many public relations forums. Since then, we've had meetings with civic organizations, community hubs. Mr. Steve Rowe was here a couple of minutes ago. He's the vice chair of the Keith Hub that Councillor Morrow referred to. And thank you for attending that community hub as well. We have another community hub meeting on the 17th, which is next week, Sherman Avenue. We're going to continue to have more public forums. We have also created a community liaison committee in which we have representatives of civic organizations. We have invitations. I have sent formal invitations to Clean Air Hamilton, to Environment Hamilton, to a number of the different community hubs, and we'll plan on having our first CLC meeting based on the responses that we get back from all of the letters on their availability based on the summer holidays, probably August, maybe even early September. The next open house is planned on September, October time period. The reason for that is this long list of ongoing studies that we have are in a process right now. And I would like to have data, valuable data, that is site-specific to Hamilton, to the specific location, in the midst of, I know the airshed is extremely important to Hamilton and has already been mentioned, not from Pittsburgh. We have many of the same issues from an airshed standpoint that you have. Pittsburgh is, you may or may not recall, but with the industrial issues and the steel issues that we've had there years ago, and respiratory sicknesses and deaths that we had in a city called Donora, which is a suburb of Pittsburgh, this is where the US EPA was created. It was a direct result of the issues that we had in Pittsburgh. So I am personally very committed to make sure that we meet all of the objectives that are set out and the additional objectives that we've laid on ourselves. For example, the last bullet talks about a human health risk assessment. That's normally a voluntary process. It's a very expensive, lengthy, time-consuming, but to us, no, this is absolutely essential. It needs to be done, and we're going to make sure that we have that finished. In conclusions, I have a couple of comments. I did read the 159-page Clean Air report. Thank you, gentlemen. Extremely well done. I looked very closely at the contaminants, at the contaminant levels. It's an extraordinary piece of work, and as a result, I have talked with all of our experts as well, and the first statement on this line is I can guarantee to you that we are not going to be a significant source of contaminants relative to existing sources in the area. We will meet Regulation 419, and the HHRA will demonstrate that there are no additional significant risk. More importantly, to me, is that the air study will consider the cumulative effects. The cumulative effects in addition to the existing effects, and we'll distinguish between that too, and we'll be able to meet those as well. I'm very committed to this process, as was mentioned. I have a technical background with Westinghouse Nuclear, with a lot of other technologies. This, by far, to me, is the most exciting, novel, innovative environmental technology that's there. We're working with McMaster University as well on non-related but related technologies with biomarkers, biointerfaces, things that would be able to work with us so that we can prove the destruction and elimination of a lot of the contaminants that are out there right now today. Again, I thank you for the time for the introduction. We'll be back. We're in the midst of a lot of technical generation right now, fact-finding generation, a lot of meetings with not just technical organizations, but generating the data for the studies that we need for the ministry. Mr. Mayor?
Thank you very much. And I might point out that Donora, Pennsylvania was the hometown of Stan Musial.
Yes, yes it is.
And I know that your relationship with the United States Navy is profound. And my uncle was a crewman on the Bunker Hill in World War II.
I know the Bunker Hill. Yeah. They have a new one out too now. The Bunker Hill is a very good ship name.
Right. So I have a speakers list. I'd rather go wax eloquent about other things, but we'll go on to our speakers. And Councillor Morrow is first. Councillor McCaddy.
Thanks very much, Mr. Mayor. Thanks very much for coming to see us today. It's great to have you come forward to this group. We've heard about the public meeting that occurred and heard comments from some of the community groups and neighborhood groups, but it's great to see you here today. I guess the I think the main question for me today, probably have a number of questions over time about the technology and stuff. We're not probably going to talk a lot about that today, but just the public process. What is the official? When I say official in terms of legislated public process that you're required to go through for a facility such as this in the location that you're considering it, Mr. Mayor?
The public process is generally to have an open house, to provide material to the general public, to meet with the general public. I think I can go past what the minimum requirements are. We have also set up a website. We've also have plans for multiple open houses. We also have formed this community liaison committee. I'm trying to make myself as available as humanly possible to meet with any organization that has a dedicated interest. I've sent personal notes out to people, to organizations. We've met with them. We'll continue to meet with them. I think the two ongoing mechanisms for continued involvement is the Community Liaison Committee that will continue on ad infinitum. But it would be a formal mechanism where multiple organizations can get in and streamline the questions, get very pointed, get very narrow, ask the scientific questions, ask the cultural questions, ask the health questions. We have a website that is up and running that we take access to questions. Generally, if a question comes in, I'll make sure it gets answered.
I guess I probably should have been more precise. That sounds great, that kind of process, but I was thinking more about the official approvals process. So I'm not aware that the City of Hamilton has any approval role in the development of the facility. Does the province of Ontario have any official role? Is there an environmental assessment or something has to be done over a certain period of time?
Yes.
Or some kind of a submission at some point in time, 90-day comment period? Just trying to get a sense beyond your own.
No, it's very good questions. Yes, the answer is yes in all cases. What we have started is the environmental screening assessment, which is the Ministry of Environment and Climate Change. It's very formal, very documented. Many of these studies that I referred to that were bulletized in that form, they come off of that requirement. Then I've added more to them. The environmental screening process is a formal requirement. And then after that, or in parallel with that, is the former COAs, it's now an ECA, environmental compliance approval. That formally has to be done. We need to have permitting approval from the environmental side, the ECA, and the ES. We also need from Hamilton Port, we need construction permitting approval. And you can probably talk a little bit more.
Yeah, and the other piece. And from a federal level, they need an environmental assessment, which is the federal regulation. So, but the ECA is probably the most stringent of all of them, which is the one that they're working through right now.
Okay. So I wonder just on that, Mr. Mayor, whether I think it would really help us if you could, or maybe our staff, or probably just ask you, if you could send us that formal process that you have to go through and all the different, milestones and stuff like that, just so we can understand what the rules are that the governments are requiring. It's always important for us as we interact with the public here in Hamilton.
I think it's a great idea. Who should I be sending this to, Mr. Mayor?
I would think probably to the clerk here today, and
I have your information. Thank you.
Including the federal process that you have to go through, given the Port Authority lands. It just sort of allows us a sense, and then just your ballpark sense of timing on how that may unfold over the next, couple of years, perhaps, or whatever time frame that you anticipate. That'll help us in addition to the sounds like comprehensive local consultation you're doing through the CLC and these public meetings and stuff like that. And I too much time, because I know time's a problem today, but the feedstock for the facility, I just read in your notes, or you touched on it up here, that the only source for the feedstock is right on the port itself, because I know a number of us were concerned about material being trucked in or perhaps by water barged in from other municipalities. And you've probably heard already that Hamilton's not crazy about receiving waste from other facilities, or other municipalities rather. That was sort of the Liberty Energy discussion
Yes.
a couple of years ago as well. So just a verification on that the feedstock is indeed just local to the other industries and other spots on the port, Mr. Mayor.
Yeah, this is what we're in the process of doing right now. Is they're called FSAs, feed supply agreements. The feed supply agreements are in preliminary format. They can't be anything more than preliminary format until you have a certified permit to be able to run the installation. The goal always has been to work as much as humanly possible within the Hamilton Port Authority and the region, because it is a good industrial reason within and around where our location is.
I think that's going to be important for us to understand as this evolves, where the feedstock comes from, what kind of feedstock it is. You've got some information here, but that'll be important for us over time.
That's a good comment that we can continue to discuss at the CLC level, so that I can get that information out to all of the relevant organizations and communities. So we'll take that too.
Thanks very much for coming today. Appreciate it.
You're welcome.
Thank you. Councillor Marula.
Thank you, Mr. Mayor. And I'd like to thank you as well for coming here today. It shows that your interest in engaging the community and ensuring that your side of the project, or what you believe to be in the best interest of not only your company but the city, is being presented. And I do appreciate that. And it's reminiscent of Wilson Nolan, who was the owner of Liberty Energy. And I sense a similar style in your presentation. And I know that Wilson and I got along very well personally. We just we never agreed on the project itself. So, but I did want to thank you for your attendance here today. My only concern, I think, and the one issue that I will dwell on today, is the issue of airshed. And from my perspective, this project, through you, Mr. Mayor, is being built in an area that we already have a challenged airshed. So if this were being built outside of that challenged area, I'd probably not have a problem with it. The problem I have is I equate it to a glass of water. If the glass is full of water and you throw more water into it, it's going to spill over, and obviously it's a presenting problem. So we really don't have much capacity for additional emissions when we have these airshed issues. So through you, Mr. Mayor, how can we reconcile supporting such an endeavor, knowing very well that we don't have the capacity to do so?
Excellent question. This is one of the reasons why I enjoy the technology as much as I do. This particular system is, just to digress scientifically for only a minute, is a completely closed loop system. One of the advantages that it has is that in the first stage of the gasifier, instead of using air, it uses oxygen steam. Air, as you probably know, is 72% nitrogen. And nitrogen is an inert gas. And there's scientific reasons why we do this and why it's much, much better. But the end result is in this closed loop system, you have a synthetic gas that goes to engines. Now, engines have well-known capabilities of processing and exhaust and whatever else. However, this gas has no nitrogen, so there's less NOx. You actually have a cleaner engine exhaust than you would if you had a normal engine that didn't run off of the cleaner synthetic gas that we have. But your overall question is dear and near to me, and it's one of the major items that we have is the airshed. We're spending an inordinate amount of time and money on the system and on the studies to be able to document this. We also, as I mentioned with McMaster, working on non-related to this specific project, but related in the sense that we want to get into the biomarkers, we want to get into the biointerfaces, we want to be able to assist McMaster develop technologies that you can walk around in your hand and take a look at the contaminants, the contaminant levels. This is a parallel approach that we have, but we are supporting exactly what your concern is.
Now, over and above that, and I appreciate the fact that you've acknowledged that, the efficiencies that exist within the system, the gasification system, work if everything is working perfectly. So if for whatever reason, and we've all heard of Swaru, I'm not sure if you're familiar with it, but locally we had an incinerator and it was Swaru, and when it was unveiled, it was state-of-the-art. Everything you're saying today about gasification, they said about Swaru back in the day. To only years later, we were subjected to one of the worst polluting incinerators in North America. So when we compare today's technology versus tomorrow's technology, and when we look at how the incinerator or how the gasification plant will be operating, and where the checks and balances are to ensure that it's always operating to that level of efficiency, and raises the question: how can we be assured that that will continually be operating to that level? Because any give and take in the operation of it obviously could be in many ways catastrophic, I guess, if in some cases, and non-catastrophic, but still have an impact on our airshed. So what assurances do we have that all of those checks and balances are in place?
There's probably about 3 or 4 different things I need to talk about very briefly. One is, because of the process that we're going through with the Ministry of Environment and Climate Change, there will be requirements for inspections, first of all, and equipment that would be installed on our plant and in our subsystems. From a ministry level, we do that. From a technical level, I already do that. I already have the systems in place on an automated response type to make sure things are operating within parameters. A third point is that, remember, I'm a nuclear type of a guy, and this is running an atmospheric pressure. So from a risk basis, it's significantly lower from a catastrophic event, which is what you described, the words used. There can't be that type of a catastrophic event at atmospheric pressures. There's a number of different, let me go a step further. The gasifiers that we use create a nice process that essentially in the first stage creates a raw synthetic gas. It goes into a plasma converter. The plasma converter is, extremely hot, 5,000 degrees or more at the flame point. Not the flame point, but actually it's an arc. Technically it's a direction of electron flows that creates this arc. It's like lightning. This breaks the compound molecular bonds into simple molecules like hydrogen or carbon monoxide or whatever. There's a number of things that in the system technically prevent these catastrophic events from happening. The reason I mentioned is to break down to simple molecules is that this system technically has the capability of taking any type of waste that you can think of and turning it into a simple molecule. So there's a lot of scientific basis inherent in the system. There's internal control systems. There's reporting systems that I have built into the system. And there's systems that the government is requiring for inspections. So we will endeavor to satisfy everyone's concern in that respect.
Mr. Mayor, lastly, with respect to what is being emitted, clearly it's not zero. We're not just emitting, it's not only emitting steam per se. There are some emissions that are going to be problematic to our airshed. So the question, I guess, is how much of that is actually contributing more to our airshed concerns?
This is one of the 2 of the studies that are being done that'll have very definitive and specific answers for you. The one assurance I wanted to give you before was that even the exhaust off the engines is cleaner than exhaust off of normal engines. So we will give you very, very specific data, and to the ministry obviously as well, as to what will be there, and then on a routine basis, these will be measured. These will be measured and they'll be reported on.
Which then comes to mind, we have some issues with the Ministry of Environment with respect to their lack of enforcement or action. So are you going to be monitoring this gasification process, or will it be an independent third party?
we're going to be operating it, and it will also be reviewed by an independent third party and the ministry. We do it because it's operational. Operators need to be able to know how the systems work and how the cars work and doing whatever else. So we operate it. We'll have a requirement to have third-party audits, third-party reviews, submit data to the Ministry of Environment. I'm not sure of what that final list is going to be yet. That's still being worked on.
So through you, Mr. Mayor, the third-party independent monitoring, who would that be? You're not sure yet?
I'm not sure yet. I'm not even sure who our APC contractor is going to be yet because we're still in negotiations.
Would you be willing to allow the city to be that third-party independent monitoring agency?
I'll take that under advisement. That's a different concept. We can talk about that.
Okay. Well, at the appropriate time, I'd like to provide that direction accordingly. And I really appreciate your time.
And the request is very specifically, again, so I can understand it.
So that we, as a city, can assess the viability or feasibility of being the independent third-party monitoring agency of the facility itself.
Okay, we should take, and when we get to that point in time in our development of the studies and our work with the Ministry of Environment, we should have that discussion.
Absolutely.
That would be a much better time to have the discussion because we're not there yet.
Granted, but I think our public health department, it should be something that they see in as a possibility down the road. I really appreciate your time. Thank you.
Thank you. I have Councillor Clark and then Councillor Collins.
Thank you, Mr. Mayor. Just a couple of quick questions, and this is actually the first significant application that the city will be dealing with under the new processes from the Ministry of Environment and Climate Change. In the past, it was an environmental assessment process, and so now we have an environmental screening assessment and then the compliance application process. So it's a little bit different. Can I ask, Mr. Mayor, whether or not your application with the Ministry of Environment and Climate Change is based on energy production or is based on waste elimination?
It's a business profile from I can give you a couple of level answers. From our investors, the fund, for example. As I mentioned before the mayor came in, one of our criteria is SRI, socially responsible investment. A lot of our investors are the Scandinavian pension funds, which are very, very environmentally astute. That's fine, but it has to have a business case. You know, you have to have the business case first, then SRI is an added benefit to it. The way we look at this, you look at a combination of a front end, back end. The front end is, do you have the omnivorous capability of processing any kind of a fuel? You know, I look at the waste as a fuel source. We call it gas plasma fuel. The versatility on the back end, shows that based on the location, if we're up in mining country, for example, they would like gas to liquids. They don't need the power. They don't need the electricity or the heat. They need diesel. They need fuel for their operations. So it depends on the location as to what the ultimate goal would be. Ours is to take the technology and make it as versatile as humanly possible, and then have it applied in different regions. We have discussions right now, Italy and China and Korea, UK, US, Poland, Croatia. One of the things I didn't mention here is in Belgium is that something called landfill mining. Places that have restricted landfills, especially in the EU, and you have no idea what's in them because of what people have done over the years. This has the capability of demining the landfill, meaning that you turn it from a brownfield into a greenfield, and that's under discussion right now in Belgium. So it's specific to the client, specific to the environment. It could be, generation of the waste could be higher, or the power could be lower, or vice versa. It's a mix.
Mayor, if I may, I appreciate that. In Ontario, we have two environmental screening processes. We have one for energy, we have one for waste. Waste is much more prescriptive, energy is fast-tracked, scoped, and more authority with the province to get it online quickly. So your application, are you doing an environmental screening as an energy-producing company or a waste elimination company? Because in the Ministry of Energy and Climate Control, there's two different processes.
I'm glad you made the distinction. It's not the fast track. It's the long, tedious, dedicated, detailed process.
Thank you. So can I ask the next question, Mr. Mayor? You have to comply under the environmental screening assessment process and follow that legislation. The Ministry of Environment and Climate Change historically says, after the applicant has filed, here are the studies that you are going to be required to do. So do we have that? Because that list could be upwards of 12, a dozen or more studies. So do you have the complete list, and has the ministry signed off on the studies?
This is the list I have added to the list. This is the list that's prescriptive from the Ministry of Environment and Climate Change. Our permitting assistance is Conestoga Rovers and Associates. That's done a lot of work in Ontario. They've worked with the ministry and worked with us and worked with our technologies. We have the minimum list, and then we added to the minimum list. So what you see here, I took from those lists.
And so to be clear then, and Conestoga Rovers is well known to many of us around this table, you've added to the list that the province has said, here's what needs to be studied. So if you've added to that list, is the province now still administering those studies and saying, yes, they're now a part of the total environmental screening?
Yes, absolutely.
Okay. With regards to the Canadian Environmental Assessment Act, has there been discussions between the Ministry of Environment and Climate Change with the Canadian Environment Assessment? We don't want duplication between two assessments. So historically, there's been an opportunity to look at the two assessment acts and say which one's going to be take precedence.
I have not done that. I worked with the Ministry of Environment and Climate Change directly, and this is the direction that I'm receiving. We have the federal level as well with the port.
So we don't know exactly what the federal component is going to be to this application.
Well, can you answer from federal?
We've looked at it and decided the ECA was the more stringent of the two processes, and that's why we've kind of encouraged Port Fuels to go down that direction.
Yep.
So
and so has the feds signed off indicating that their Environmental Assessment Act is not going to be applied?
No, not at this stage. The first process is to get the ECA into place.
Thank you. With respect to the human health risk assessment, what role is our public health department going to play in that assessment?
I'm not sure at this stage yet. That hasn't been started. The other studies have started. This is just in the process of getting started.
Okay. I'd love to ask that question of staff if given the opportunity. Finally, what approval processes does the city have?
I believe on the planning side.
I know we deal with zoning, and we're a commenting agency, but we have a compelling public interest in the community to be participating in this as to more than just a commenting agency. So how involved are you willing to have the municipality at the table, again, to verify that all of the data is, as we say, kosher?
I have no problem discussing anything with the municipality.
Thank you, and if I could just ask that question of staff, that'd be great.
All right, thank you. Councillor Collins is next.
Thanks, Mr. Mayor. Through you to the presenter. Sir, can I ask, the lease that you have with the Port Authority, is it a long-term lease, a short-term lease, a medium-term lease at this point in time? Assuming it's all on based on the approval process as well. Through you, Mr. Chairman.
Yes, we're working with them on a 20-year lease with options for 10-year consecutive extensions.
Okay. And through you, Mr. Chairman, then I think I stepped out of the room when you were answering Councillor McCaddy's question as it relates to where the waste is coming from, and I thought I caught your answer that you were still in the process of trying to secure, as I understand it, prospective clients, customers to feed the facility. Is that, will the materials be local in general, or are they coming from outside of the municipality?
Yes, they're called feed supply agreements, and the majority of what we're looking for is coming within the port or the adjacent industrial area around the port.
So it would be trucked, but primarily trucked to the
Truck,
facility?
rail, ship. There's 180 tenants in the port? Yeah. There's 180 tenants in the port. There's maritime waste. All the ships have maritime waste. So it's a combination. But the absolute goal, and what I was referring to before, is treat as close to the source as possible. This is your best green footprint, is to treat it at the source.
Okay, thanks for that. And through you, I know that our own planning staff has determined that, in fact, you're on, I believe, either J or K zoned lands currently, and your type of facility would not be permitted under the current zoning, would require a rezoning application, much like Liberty Energy, which was referenced earlier today. They were required to go through a rezoning application. And I didn't hear, as part of your approval process, any reference to municipal zoning and compliance with the city's planning bylaws. So is there a reason why your company has yet to, and maybe it's in the works, you've yet to apply for a municipal rezoning application?
Now, refresh me with Liberty Energy. Are they on HPA lands, or where were they?
No,
they're east?
No, they're on Strathern Avenue. They're outside of the HPA's.
Okay. This is still under review. We haven't, as I mentioned, I think last time we had met at the open house, that's still under review. We haven't processed anything yet. I haven't met with the planning committee of the city council or anyone yet.
So if the city determines that in fact one is required, you would then obviously submit?
I'd like to discuss whatever it was that you had determined. And actually we will comply with whatever is required as a result of determinations.
Okay. Has anyone from the port discussed it with city staff as yet in terms of their tenant?
I'm sorry, I can't hear you.
Has anyone from the Port Authority, maybe it's a question for Mr. Hamilton, is there anyone from the Port Authority discussed the zoning issues with the city?
There hasn't been a specific discussion. We've talked about introducing it and going through the process of introducing what the project is. Certainly, we took a long time reviewing the urban plan and felt that it was consistent with what was outlined inside of the urban plan before we entered into any arrangements with Port Fuels. So, and certainly, we've had no notification that this is outside of the existing zoning. So that your comment kind of comes as a bit of a surprise because we haven't put a formal application or a zoning, whatever they call it when they have to zoning verification. And that all comes through at the end, and the ECA gets a time when they get the full description of the project, and then the city has a chance to comment on it. That's when I think the zoning will come into place. So I haven't heard of any clear-cut answer or opinion that it was outside of the existing zoning.
Yeah, and I've never been through the application process myself, but it seems like you're spending a lot of resources on a facility that may end up being on lands that do not permit it. And so I mean, my own personal experience would be that you'd probably be best to go through the rezoning application first, understand that you're operating on lands then that can facilitate the construction of a facility like the one that's being proposed, and then start going through the provincial and federal processes. It almost seems like maybe getting the other approvals that might be a bit easier to achieve, and then coming for maybe the most difficult one, because there is a public process. Obviously, it can be appealed when it's under the city's and the province's Planning Act, and residents and others would have the ability to come out and voice either their support or their opposition to the project. So I'm curious to know why it doesn't seem like a lot of you have a lot of information in front of us here today. And there seems to be a lot of knowledge about provincial and federal processes. And the only question that relates to the city is one in which it doesn't seem like there's been a lot of due diligence, which is a little bit surprising.
Yeah, and again, just to reiterate, I don't think there's been a definitive position that a rezoning application is required at this stage.
Okay, so we can have then, we can direct our planning staff. I do have a message here from our planning staff this afternoon who state that they have contacted the city planning staff has contacted or emailed the proponent months ago at the email address on the business card that was provided to request a meeting, and to date no one has replied. So maybe we can ask through you, Mr. Chairman, that our planning staff reconnect with the applicant based on some of the information that was provided here today, and we try to get to the bottom of whether a rezoning application, certainly in the minds of our staff, one is required, but it would be best maybe to have a conversation first with the proponent, and hopefully we'll see something here in front of us in the next couple of months.
And we can make that happen, Councillor, but as I recall, there was direction given, and it sounds like our staff did follow up, and our staff did indicate to the council in a GIC meeting that zoning was required. So, any further comments?
No, we'll just wait and have the discussion.
Okay. Only questions at this point in time. Thank you.
Councillor Morrow, please.
I was remiss in also not expressing appreciation to the, number 2 man in the Port Authority. And in days gone by, the former Harbor Commissioners would have quite possibly refused to have come to the meeting or told us we had no jurisdiction or whatever. And there's been a change in approach, which is much appreciated by someone who had to endure some of those other situations before the changes that took place about the year 2000. So I appreciate that presence here today as well.
Thank you, Councillor. Thank you for appearing today. I would encourage you to speak with the General Manager, Planning Economic Development, to clarify the zoning issue as quickly as possible, to save everyone a little bit of grief if possible. I need a motion then to receive the presentation. Moved by Councillor Morrow, seconded by Councillor Pearson. All those in favor? Carried. Thank you very much. And again, welcome to Hamilton. Vaccine program, 7.2, councillors on your agenda. I'd like to call on Kim, Manager of Vaccine Program, to provide a presentation respecting the vaccine program update. Councillor Jackson, please.
Just a point of order on that last motion. I don't think we had quorum in here to that. I'm just doing a quick check, and I just want to bring that to your attention.
Thank you. You're correct. Yeah, Councillor Morrow has done it again. He voted twice. No, we'll fix that. Thank you very much. When Councillor Duval comes back, we'll fix that motion. And at the same time, Councillor Collins, you may want to move that motion with regards to, so we don't drop that ball on the. Yep, absolutely. Thank you. Clearly you didn't speak loud enough, Robert. Okay, we're ready.
Sorry, they get a lesson on the clicker.
Stick it to us.
Hi. Thank you for having me this afternoon. So I'm here to just present on the report that was written in front of you today, just providing you an update on the vaccine program and some of the pressures and areas for opportunity that we have.
And the clicker is stuck.
Clicker does not work. So just quickly, we're going to talk about the recommendations, provide you an update on, again, what those program areas are, as well as how we've seen some changes in our flu program over the last few years, and how we might actually be able to use our resources better to look at other opportunities for our program deliverables. The recommendations are in the report, so just in an interest of time, I won't walk you through them, but we're really looking at how can we deliver our flu program as well as our other programs such as our school-based immunization program in better ways to meet the needs of the community of Hamilton, and looking at using those resources in a little bit of a better way. So just as a background, immunization for the Ministry of Health is a priority area where we offer our services under the Ontario Public Health Standards. And as such, because this is a priority area on the strategic plan for the ministry, they are incorporating and rolling out a lot of new initiatives and new programs for immunizations. For example, we've had new vaccines introduced in the last several years. New service providers are now providing flu vaccinations in the fall, as well as there's immunization provincial review that's going on. So we're anticipating some changes, possibly some more new vaccines being rolled out. And there's also a provincial audit of the immunization program that Hamilton is not participating in, but the auditor's office is looking at more efficient ways to manage immunization programs provincially. We are part of, we have accountabilities to the ministry for a lot of our program areas. We have 6 accountability indicators and monitoring indicators. And so that's creating a lot of additional pressures in a lot of our program areas, such as our school-based program and our vaccine storage and handling program. So I'll get into a little bit of that in a bit. And while there's been a demand in our large program areas, we've also seen a decrease in community need for other program areas like our influenza program. Since about 2010, we've seen a decrease in uptake at our large community flu-based clinics. And that's part and parcel because it's a lot easier and more convenient for people to access the flu vaccine. So as I mentioned, we are accountable to the Ministry of Health under the Public Health Standards and Protocols. We have 2 protocols, a management of immunization protocol and a vaccine storage and handling protocol, as well as we have 6 accountability indicators that we're required to meet. 3 of those are for coverage rates for the immunizations we administer in the schools. 2 are for vaccine wastage for the HPV vaccine and influenza vaccine specifically. And this year we have a new accountability indicator that's been added by the Ministry of Health for the completion rate of inspections of refrigerators that store publicly funded vaccine. So one of the main areas of our program that is experiencing growth and significant pressures is our school immunization program. This program is responsible for going into approximately 120 schools 3 times a year to administer vaccines to grade 7 and grade 8 students. So for the grade 7 students, we go in and we administer a 2-dose program of hepatitis B, and we administer a 1-dose program of meningococcal vaccine. For the grade 8 girls only, we administer a 3-dose series of human papillomavirus or HPV vaccine to those groups. So to put it into perspective, my team of nurses has administered approximately 20,000 immunizations in our schools in the last school year, so 2013-2014. Something of particular note with this program is that we are the only main service provider of these vaccines. Physicians do not administer these vaccines in our community unless it's part of a catch-up program. So oftentimes we see from the ministry that when a new vaccine is rolled out, that a catch-up program is taken place so that we can catch up those cohorts that didn't have the opportunity for those vaccines earlier on. And that's really their limited scope in providing these vaccines, other than whether or not there's a student that for their own safety, like a contraindication to that vaccine, would receive it and we'd release it to their family doctor for that purpose. So as I mentioned, we have accountability agreements with the ministry, and in previous reports that have been coming forward to the Board of Health, we are actually meeting our indicators for that from our ministry database. But what we've recognized over the years is that we are meeting and exceeding in some cases what those accountability indicators are, but how do we maintain those? How do we ensure that those numbers don't slip off? Because for ideal immunity for our community, we want coverage rates of about 90% for the city of Hamilton. So what we undertook, I think in around 2010, 2011, was a review of our school immunization program. We really wanted to understand what were some of the barriers for returning consents, what were some of the barriers for receiving immunizations, and out of that we were able to engage parents, school boards, through surveys to create resources and create more useful consents so that people had the information and it was tailored to their specific need. So despite meeting our coverage rates, we started to pick apart the data a little bit more. And what we found was kind of very interesting. We took an analysis, of schools within their own individual wards and within priority neighborhoods. And we actually found that there's significant variation between certain parts of the city and elsewhere in those coverage rates. And we're trying to understand what that actually means for our program and how we can increase. So although we're meeting coverage rates provincially, we know that we have pockets in our city that aren't getting the coverage rates that they should, and it's kind of bringing us down. So we could be a little better than we actually are. So we're still trying to make sense of that, and we're looking at how we can actually tailor strategies to those regions or those areas and neighborhoods of our city to increase those up. So some of the things that we've started to do is we've met with Paul Johnson and Suzanne Brown at the Neighborhood Action Strategy to understand what this might mean. I went out to a meeting with the community development workers to really understand why maybe these consents aren't getting returned to us, why parents may not be interested in the vaccinations. So we've started to work through some of those issues and come up with some pretty good ideas. But we, at this point in time, are lacking some of the resources that we need to fully implement and meet with the schools on an individual basis, because the nurses, in going out to those schools 3 times a year, don't have the time to sit and meet with principals and develop, strategies that are unique to them. We also have done some work with the Juravinski Cancer Center, as well as the Children's Aid Society that took particular interest in the HPV vaccine. So we came up with some strategies with them as well to look at how we might increase the HPV vaccination coverage rates in particular. But just due to time constraints and some of the pressures that we're experiencing, we haven't fully been able to realize some of those things. So we're wanting to move the school immunization program to a stage where we can engage people more, we can increase those coverage rates, and really focus on our targeted and tailored approaches for our neighborhoods. So I'm just going to run you through a series of maps. This is a 2-dose program of hepatitis B. So these are for all the students that have completed a 2-dose series, is how we measure coverage. So the hepatitis B program in '94 started as a 3-dose. It's now a 2-dose program since 2000. Some of the struggles that we're finding with hepatitis B to increase those rates are that a lot of the students in some areas of the city are receiving the Twinrix vaccination, which is a combined hepatitis A and hepatitis B vaccination. So that's kind of lowering the coverage rates for that. The database isn't able to measure that. But you can see here that there are some significant areas of the city where the red dots are, where we're not getting those coverage rates up where they should be. This is the meningococcal, and again, you can start to notice that you'll see some similarities and some commonalities in the wards that are actually experiencing more of the red dots. Meningococcal is only a 1-dose program, so we don't tend to see a lot of the same issues as we do with hepatitis B, or as I'll show you in the HPV. It's quite interesting because it is a 1-dose shot and it's easier to catch them up. But with a 2-dose series, you start them with the first dose. If they don't finish the second, they're not showing up on this map as completed. So I've broken the HPV maps out for you. We introduced HPV out in the schools in 2007, and it was an interesting program to roll out. A lot of contentious issues with this vaccination for girls. Primarily it's to protect against cervical cancer, but it's also protects against a lot of other cancers like throat cancers and stuff. So we're trying to get that message out. But this is the first dose, and overall, you can see the green, it's light, and some of it is white. And this is the first dose. There are pockets of, there's lots of red dots where the coverage is, 0 to 60%, and there's about 29 schools that meets. But when I start to move it to the second dose, you can start to see the green shades are getting darker and darker, which means overall as a city, our coverage is actually decreasing with each consecutive dose. And in particular in Ward 14, for example, they have a green dot just at the bottom of the screen. Just by 1 dose, they've gone to red. So, and then there's your 3rd dose. So it's quite significantly green, and so it's one of the vaccinations, and look at all the red. So we do have some work there that we need to do. We've gone from 29 schools up to 55 schools that have actually got a 0 to 60% coverage rate. So I'm not happy with that as a program manager, and there's lots that I'd like to be able to do. And when I look at my program, it's how do we better utilize our resources to be accountable to our constituents and our community for coverage, making sure that everybody has equal opportunity. So another program area that is experiencing a lot of increased work and pressure is our vaccine storage and handling. And you may have heard this program before, or I've been up in front of audit, finance, and accounting discussing a cold chain audit that we had done. But this program is essentially responsible for ensuring that the vaccine supply that we provide out to healthcare providers and administered maintains its integrity. So it's divided into two different program areas. The first is the refrigerator inspections. And I have staff that go out and inspect. Well, this year there's over 400 refrigerators that need to be inspected. And that also includes, there's 400 refrigerators that need to be inspected. It's also 400 refrigerators or facilities that we need to supply vaccine to. So as new vaccines get rolled out, as new providers come on, the workload and the pressures are increasing. And we are accountable to the ministry, as I said, this year to ensure that we have 100% completion rate of inspections. I don't anticipate any issues with that because we've had 100% completion with our refrigerators. It just means we're trying to divert more resources into these programs that we have these accountabilities for. One of the main reasons that we have seen the increase jump for pharmacies or for refrigerator inspections are because we have pharmacies coming on board to administer flu vaccines, which I think is a fantastic program that the ministry is rolling out. But the unfortunate side of that is we aren't receiving any additional funding for that. We receive nominal increase in reimbursement for things like mileage or printing for the forms, but as we go electronic. So we're doing all of this work within existing staffing resources. And as I say, the staff who receive the orders are processing them, checking to make sure that everything is okay, and they're getting inundated as well. So as I said, along with more refrigerators becomes more vaccine orders, and it also means that staff are looking and making sure that when physicians are storing vaccine or when they are ordering vaccines, that they've actually maintained the integrity of that vaccine. And when that vaccine doesn't have its integrity maintained, they're required to call our health department to report that, and I have staff that actually will investigate and make a recommendation and determine whether or not that vaccine is suitable for use. And we call that a cold chain failure when that happens. So some of the primary reasons for that are, when we have power failures, I cringe the next business day coming in because we know that the phone is going to be inundated. So we have to call extra staff to make sure that those calls and they can get followed up quickly, because anytime there's a failure for a physician, they can't use their vaccine, which means that that child or that opportunity to provide a vaccination to somebody has been missed. And that's not something that we want to have happen. So we can't do anything to mitigate power failures due to extreme weather or just blackouts. But one of the things that we are trying to do a lot of work on is equipment malfunction, so making sure that staff know how to problem solve and troubleshoot those, but also around human error. Human errors happen, but we're trying to provide that education and minimize those. So, we have 193 failures that my staff dealt with in 2013, and we're 54 as of June 11th. So one area where there has been a decline in request for service from the community is our universal influenza immunization program. So this program was rolled out by the ministry as a universal program in 2000, and we actually, at its height, would provide 20 to 24 clinics out in the community, and they'd be held at malls, community centers. There'd be lineups. I remember coming to the Lime Ridge Mall, and there'd be a lineup all the way from where the Old Navy or Santa was, all the way to the Bay. People waiting hours before to get their vaccinations. We're not seeing any of that anymore, and we kind of noticed a difference after H1N1 happened. So it's hard to speculate the reason why. We can say that it's apathy, but one of the things that I can tell you, and I'll show you the slides in a bit, is that it's not that they're not getting vaccinated. They're going somewhere else now. The accessibility of flu vaccines since H1N1, just prior to that, started to ramp up, is that people can get this vaccine at their workplaces. Workplaces are hiring nursing agencies to go into TD Canada trusts, to go into grocery stores. Stelco, Dofasco, they have occupational health places. The City of Hamilton has a knock health nurse. They're offering employee flu clinics for people and their families to get vaccinated. One of the downsides of not being able to provide these immunizations is that we're faced with some financial pressures. We're reimbursed $5 a dose to provide this program, to arrange medical supplies, to arrange advertising and promotion, to rent facilities, to pay for staffing. We can't sustain that cost anymore. So this is the slide I was going to show you. In the blue is all of the doses that we've administered at public health large base clinics since primarily 2010. I left 2009 out. It was an anomaly year. We were giving a lot of H1N1 vaccine and not a lot of the regular seasonal flu vaccine. But what you'll see is that as our attendance declined at public health-led clinics, large-based clinics, we still maintain the distribution out to healthcare providers in our community. So we're not seeing a decrease in uptake of the vaccine in the community. We're seeing it at our clinics. And this slide is just, I broke it down into a pie chart of just who's administering what now. And interestingly enough, in 2012, when pharmacies came on board, the provincial data showed that pharmacies were giving 8% of the influenza vaccine provincially, and health units were giving 9%. In the 2013-14 season, provincially, health units were giving 6%. And pharmacies are up 24%. So what we're seeing in Hamilton is quite consistent what's going on provincially, where last year pharmacies gave 21% of all the flu vaccinations that were distributed in the city of Hamilton. And as public health services, we only accounted for 2%. So, I mean, my own personal bias is that pharmacies are a success. I think they're an excellent way for people to go and get their immunizations. They're convenient. People can just walk in. Some pharmacies have been holding large clinics. Others, they're just allowing people to walk in and receive their flu vaccination at a time that's convenient for them. Our large-based community flu clinics are held for like 3 or 4 hour periods in a chunk of day where we try and make sure that they're accessible and that they're held at times of day where people can get to. But with pharmacies, some of them have 24-hour access to this service, which I think meets the needs of a lot of the people in our community. One of the things, and one of the gaps with having pharmacies on board, though, however, is that they aren't permitted under their regulation to administer influenza vaccinations to children who are under the age of 5. So that's a gap that as public health we're willing to continue to administer those vaccines to those children through other means. So we have 3 community-based clinics, one on the mountain, one in the East End, and one in Dundas, to provide those vaccinations for their children on an appointment-based, as well as we have there's other individuals who are at risk of influenza-related complications that pharmacists can do, but we would also provide those vaccinations at our clinic sites as well as continue to go out to some of those high-priority locations that are serving our hard-to-reach populations, such as Wesley, the Good Shepherd, and those types of places. So in 2012-13, the ministry took a phased-in approach with getting pharmacies on board. They wanted to make sure that the program was successful, and I had the opportunity to sit at the table and advocate for health units on that. But last year we brought on 100 pharmacies, and this year I actually spoke with the ministry to get an update before I came today, and it was my goal to beat 100 pharmacies last year, and we're at 109 with 2 more days left of the application process. So I'm quite pleased with that. There were, at last count, about 180 pharmacies within Hamilton, so we're looking at how we can get those other pharmacies on board. And this final map is actually from our 2013-14 flu season, and it just depicts for you where people had access to their influenza vaccines across the city. And this is something, as a manager, I'm looking at with my director and my associate medical officer of health, is because one of the recommendations is to hold, instead of a large community-based flu clinic model, to have 1 or 2 health fairs that we work in conjunction with community and emergency services with Paul Johnson, how we can actually make sure that those health fairs are put into areas of our city that actually we can pilot it and do a really great job and make sure that they're meeting areas where there's limited access, but there's also those priority individuals that we want to reach. So we haven't landed on where those will be. We're open to that location. We'd like to tie it into something that's already existing or will be going on in that community. So we are open to suggestions for that. So just in summary, we don't anticipate that there's going to be an impact to the net levy with this new model that we're suggesting or recommending to you. The nursing time that would normally be spent organizing and planning large clinics can be spent administering and focused on programs that only us as a health unit can deliver that we're mandated by the ministry to actually do. And then again, one of my goals with this program is to really make sure that it's meeting the needs of the community. So I'm looking forward to working with community services and looking at how we can make flu vaccine targeted and tailored to those individuals. But not only that, but with our school-based immunization program, because as I showed you, I have a hard time with the way that those coverage maps look and how there's that disparity within our community. So that's all I have.
Excellent. Thank you very much, Kim. Councillor Jackson, please.
Thanks, Mr. Deputy Mayor. Thank you, Kim. If you could just put that slide, your summary back up, if that's possible. Thank you. Very interesting presentation and information. I was listening very carefully, Kim, so I'll just give you my interpretation of what you said. From a layman's standpoint, you just tell me correct or incorrect and clarify. So have I heard overall that immunization, there's no real decline in interest in immunization across our community? Mr. Deputy Mayor, through to Kim. Kim?
Through you, Mr. Deputy Mayor, that's correct.
So, however, though, there seems to be a decline in attending public health service clinics. Through you, Mr. Deputy Mayor, to Kim.
Through you, Mr. Deputy Mayor, yes.
Now, I've always felt our public health department, public health services, is a leader in so many areas of providing public health services on many fronts in our community. Were we not marketing these clinics well? Were people for some reason just feeling adverse to attending, going into our clinics? Did they not know the location of that part to me was a little baffling, Mr. Deputy Mayor. Through to Kim, maybe for further explanation or reasons?
Through you, Mr. Deputy Mayor. I think the reason that we're seeing a decline in our community clinics that are led by us is not due to a lack of advertising, although we don't have the funds to do the advertising that we would like to do. I think it has more to do with the accessibility of where people can go for their influenza vaccinations. So people can get flu shots at their family doctor, they can get them at walk-in clinics, they can get them through workplaces, and they can get them at pharmacies now. So with the coming on of pharmacies into the flu program, that's when we've seen the most dramatic decline in uptake at our clinics. We had people come to our clinics last year that would see an initial lineup at the beginning of the clinic and not want to wait and tell us that they were actually going to leave and go to the pharmacy across the street. Pharmacies are more convenient and they're a lot more readily accessible in people's neighborhoods. And that's why I believe that we've seen the decrease in our uptake at our public health clinics.
But nobody wants to wait in a lineup, Kim. Did we not anticipate when we had the lineups before now the disbursement into pharmacies and other alternate service providers? Do we not have the staff resources to support those clinics? I'm a little bit puzzled by, because those days of, well, I guess maybe one of the last ones remaining, Mr. Deputy Mayor, might be where you have to get your car plate and or driver's license, possibly. I just had mine done, and that's still a fair lineup at a time. You might as well put a good half hour to an hour aside with the taking of the number in that. But I'm still a little puzzled by that, Kim. Were we not anticipating the lineups and people decided, you know what, I'm frustrated going to a public health service clinic. I'm just going to go to my pharmacist. Through you, Mr. Deputy Mayor.
For you, Mr. Deputy Mayor, last year and the year before, with the most significant decline at our attendance, it wasn't because people didn't want to wait in the lines. We certainly had the biggest lineup at the start of the clinic, but we were running a clinic for 4 hours, and towards the end, we're actually sending staff home because there is nobody coming to the clinic. We see the most and the highest uptake at the beginning, within that first 30 minutes to 60 minutes, and afterwards, we're seeing nothing.
Last question, are we going to now, with precious restraint on budgets and that we all have, are you looking to, as program manager, reallocating the resources that you have in terms of you want to get more into the schools as public health services, or again with the schools, wouldn't families be already using their pharmacists and the alternate service providers, as you said, many have gone to? Through you, Mr. Deputy Mayor.
Through you, Mr. Deputy Mayor. So last year we offered 12 flu clinics in the community. I have 6 teams of 2 nurses for each team going out to those clinics. So that's 6 times 12 schools that we could be spending more time in the fall, when it's the most difficult time to get people to get their immunizations for that first dose. If we don't catch them at that first dose, we find it's more difficult to get them caught up in subsequent doses, and that affects our coverage rates and especially our accountability with the ministry. So yes, the intent is that by stopping the large-based flu clinics, that those resources would be reallocated so that those people who are doing the planning, booking the sites, ordering the supplies, would be able, and then ultimately administering the flu shots, would be able to be in the schools, get to know those schools, get to know the issues and the uniqueness of each of them, to be able to administer a better program for the school-based immunization program that only we can do.
Well, Kim, I at least admire you for trying to stay ahead of the curve and seeing where the curve was going and making these kind of adjustments as well. So thanks for the answers to my questions, Mr. Deputy Mayor.
Thank you. Councillor Pursuta.
Thank you, Deputy Mayor Clark, and Kim, thanks for the report up here in front of us. My ward being Ward 14, and don't usually talk too much about it, but Ward 14, when I look on the map down here, community locations offering influenza vaccinations, 2013-2014. Largest ward in the city. It shows one doctor here. We do have 2. We're trying to save one in Linden. No pharmacies. How do we support the people out there?
Yeah, it's through you, Mr. Deputy Mayor. That's one of the things, honestly, that I am struggling with, is that there are areas of the city where there isn't access to that. One of the things that we are looking at doing is promoting where that access is for individuals to go. So if they don't have healthcare providers within their ward, where are they going for their healthcare? Are they coming into the core of the city? Providing that information to them on our web. There is a flu locator that we actually utilize so that people, if they want to get their immunization, can look there and see. If there are significant issues with accessibility, one of the areas that we are looking at, particularly, for instance, with the Community Care Access Center, is how to work with them and more community partners to maybe bring the vaccine to them. Unfortunately, at this time, pharmacists can only administer vaccines within the 4 walls of their pharmacy. It's part of their agreement with the ministry. But as an advocate for pharmacies around that ministry table, I'm trying to get pharmacies to be able to administer vaccine and go out to more places. So maybe one day they'll actually be going into our community and administering them at community centers. But historically, Councillor, there has not been a flu clinic held in your ward.
So I guess my question here then is, are you getting calls from the residents out there, particularly in Ward 14, asking about where the clinics are, where they can go? Are you getting calls? Are you keeping track of that?
Yeah. Through you, Mr. Deputy Mayor, the call center actually will field a lot of our calls, but in my years of working with this program, I've not received any calls from your ward asking, requesting this service.
Okay, thank you very much. Thank you, Kim. Deputy Mayor.
Is it different? I don't know. Maybe are you hearing like?
No, I haven't heard a whole lot.
Okay.
They look after themselves out there in the wilds.
Thank
you.
Councillor Jackson, if you can take the chair for a second, please. I just have a few questions. Thank you very much. Excellent presentation, and With regards to the goals that are noted for all the different vaccines, are they provincial goals or are they our goals?
Through you, Mr. Deputy Mayor.
How about Chairman? How's that?
Oh, Chair. Those are ministry goals.
I'm trying to, and I'm sure there's an excellent rationale for it, but why the different goals for the different viruses? There's a lower goal for HPV than meningococcal, and likewise hepatitis B. So I'm trying to understand if the goal is to prevent.
Yeah.
Why wouldn't we have simply a 90% goal for all of the vaccines? Why can we have such unique goals for each vaccine?
Yeah.
Kim?
Through you, Mr. Chair. Sorry. I'd like to correct my first answer. The ministry is requiring health units to set indicators for their health unit region. They make a proposal for a target. We respond to that proposal. And out of that proposal, these were the targets that we came to an agreement with the ministry that as a health unit we would meet. Recognizing that with HPV, there are unique issues with the way that it was rolled out and concerns with our community on the administration of this vaccine to young women. We're trying to dispel those myths and the misinformation for that. We set lower targets for the HPV vaccination versus the other ones, and that's based on what we have captured in our database for coverage rates for those. I certainly do want to exceed that. We need to exceed that, but we need to be realistic in what our goals are as well and for achieving that. And anytime we don't achieve a goal, we need to account for that with the Ministry of Health as well. I can tell you that provincially, those targets are about the same for all of health units in the province.
So then if it is a collaborative goal and they are attainable goals based on the actuals, why wouldn't the goal go up? So for example, hepatitis B, the target now is 80%. Last year we achieved 90%. Actual currently is 90%. So for 2014, the logical inference for me would be to increase the goal to 90%. Likewise in meningococcal. And likewise in HPV, the target is 65, the target was 55, we're hitting 75. It seems that we're understating our goals when we can overachieve.
Kim?
Through you, Mr. Chair. I don't have the targets for this year coming up, but I do know that they are increased. There are some issues just with the ministry is switching over to a new database this year called Panorama. So there are those considerations that the ministry as well as health units are taking into looking at when we're setting our targets for this upcoming year, but they have increased.
And is Public Health Board involved in the final decision on those goals, or is it something that is just arbitrary to the medical officer of health?
Through you, Mr. Chair, those reports do come forward to the Board of Health for approval.
So we'll have that opportunity to flesh that out when we get new numbers?
Through you, Mr. Chair, I believe that report has already come forward. No?
Deputy Mayor, Mr. Chair, I need to go back and see which ones have come and which ones have not at this point. These vaccine targets, because they're at a different point in the year than the others, come at different times. The final targets come as part of our accountability agreement, which won't come now, we're understanding, probably until October, which is quite late.
So just to be clear, Mr. Chair, I mean, I've raised this every time we have targets. The goal is to, in my mind, organizational behavior, let's achieve past that goal. So if we're already achieving the goal, then it would make sense not to have a lower threshold, that we should be now moving to the next threshold. So I'll leave it with our public health staff to proceed and understand that. Just a question about the cold chain failures. Are there alarms required on the refrigerators in the doctor's offices and the pharmacies that indicate there's been a power failure?
Through you, Mr. Chair, no. It's not a requirement of physician or private practices to alarm their refrigerators. What is a requirement is that they are checking, that they have a thermometer that monitors the temperature of the quality or the temperature of the fridge, and they are required to document and record the maximum, minimum, and current temperature of the refrigerator twice a day.
So theoretically, the power could be off all night, and is there an impact on vaccine if we have a 12-hour power failure?
Through you, Mr. Chair, there potentially is. That is why anytime there's a power failure or anytime there is we call it a temperature excursion or a violation outside the range that they're supposed to be stored, they're required to call us. And that's why we're requiring them to document as well.
Given that there's that broken chain, we'll use the same analogy.
Yep.
Is it something that the Public Health Board can deal with in terms of requiring that a power failure alarm be set on fridges that are holding vaccines, so that it actually gives an indication that overnight there was a 10-hour power interruption and the vaccine may be compromised? Thank you.
Through you, Mr. Chair. As a public health unit, we go out and we inspect and we enforce the requirements that the ministry has through the vaccine storage and handling protocol. The vaccine storage and handling protocol does not require physicians to do that, but it certainly is at the discretion of the medical officer of health to implement increased measures, should that be. I can tell you that no other health unit does require that, and that we may get some pushback from physicians because they are quite costly measures. So I certainly am not making excuses for them. I think we're trying to do everything that we can to maintain the integrity of the vaccine and to minimize wastage. But there are...
That our healthcare system pays for any subsequent failure of a vaccine because they didn't know about it in the long term. Wouldn't it be prudent for us to look at this? And I look to now Dr. Richardson. Yep. This seems to be, and I tried to get at it last year, but this shows very clearly there's a bit of a challenge. So how would you recommend that we proceed? Writing to the minister, leaving it with you to come back with some ideas on how we would proceed?
Dr. Richardson?
That's for you, Mr. Chair. This whole issue of cold chain has been long negotiated between sort of the institutions of the province as opposed to on a local level. So the vaccine program at the ministry level has been working with the College of Physicians and Surgeons and the OMA to look at what's reasonable, what can be expected as it rolls out and moves forward. You know, that we've gone from having thermometers in fridges to hardwiring fridges to various different things that have been negotiated and agreed upon. So I would suggest in this case it would be better to write to the minister about, you know, our concerns about taking this one step further in regard to this. You know, we certainly converse with our local docs all the time on what can they do and do better, as Kim's been outlining, and we'll continue to do that, but I would encourage some province-wide action on it.
Yeah, and I understand that, Madam Chair, and Mr. Chair, and I thank you, Dr. Richardson, but it's a protracted discussion between the OMA and the province on numerous items when they're dealing with the OMA. We now know very clearly that there could be a broken chain, and at over 12 hours, if there's a power failure of 12 hours, there's an issue, and they may not have known that there was a power failure. Frequently, it's very local, and if no one tells them, then they don't know. To leave it without comment and not to address it as a board of public health, I would say is inappropriate. So we need to do something. Perhaps you could come back with a report to us in terms of what the recommendations would be, how to go forward, but we're now aware of that. So we have to deal with it somehow, Mr. Chairman.
Can you bring that back, Dr. Liz, please?
Through you, Mr. Chair, I think I was misunderstood. I was suggesting that we do write to the minister.
Okay.
And suggest that there be something
So
more
then
done.
if, at the appropriate time, one of my colleagues can make that motion, or Councillor Jackson, perhaps you could, given that I'm in the chair, and then we can deal with that one specifically.
Sorry, through you, Mr. Chair, can I add something just to clarify?
Please.
just because there's a power failure doesn't mean that the vaccine is wasted.
What?
We assess the vaccine, and oftentimes there is no wastage for that. It's those long extended ones that are
and
worrisome
that's
for us.
If there isn't an alarm on a system, pharmaceutical companies have alarms on their systems, on their fridges. If there's a power failure, they know how long it's been and they can dispose of the vaccines. If the doctors and the pharmacies don't have that and it's a protracted power failure and they're unaware of how long it is, then they're handing out vaccine that may have been weakened. We don't know that. And since we know that there's an issue, we should address the minister saying this needs to be addressed in the discussions at the OMA and that this board is raising a concern about it. That's all I'm
Correct.
saying, Mr. Chair.
Perfect. That's great.
Okay. Can I just ask, the final question is with regards to influenza vaccine use. When I'm looking at that chart, that's the one. Nope, back. There we go. And just visually, it looks like there's a decline. When I do the mathematics of it, and I'm assuming that I should be taking the influenza doses administered by PHS and adding it to the influenza doses distributed because they're two separate amounts, and then compare it to the aggregate for 2013, I get a 30% reduction in influenza use. So the public doesn't seem to be actually taking, or I guess in 2003, there was more interest in an influenza vaccine and getting the shots than there is today, or in 2013. I don't know if we've assessed why that is the case, but it is concerning given that we don't need H1N1 to have a influenza that can cause fatalities in the chronically ill and young people. So what's the province doing, or what are we doing to promote better use of the vaccine, that people should be getting it? And not to mention the numbers there, Mr. Chairman, are far less than the general population of the city of Hamilton.
Kim?
Through you, Mr. Chair. We're actually doing quite a fair amount of work with the healthcare sector. We meet monthly with members from our local hospitals, with community care access centers, with pharmacies, with family physicians to have these discussions about how can we make influenza immunization more of a priority for our community, particularly with healthcare workers as well as our vulnerable sector as well. Some of the things that we've done at that group is advocate to the Ministry of Health for different types of vaccinations that people might be more interested in. As well as looking at how we can promote and work more collaboratively together as partners in the promotion of influenza vaccinations. So over the last couple of years, we've done joint marketing with Hamilton Health Sciences and St. Joseph's, and we're continuing to work on that partnership. But it's our goal as a working group to increase, and some of the other things that we're looking at is mandatory vaccinations as well.
Yeah, I guess my concern is when I'm out in the community and the discussion of influenza vaccine comes up, you hear the general comments, one, it doesn't work, or two, I got the vaccine and I got sick, so I'm not getting the vaccine. And those scientifically don't pan out. And when I see a 30% reduction in what we were successfully distributing in 2003, it's a little bit disconcerting. So I'll leave it with our staff to deal with that. And the recommendation today is to discontinue community-based influenza vaccines. Given what Councillor Pursuta raised with regards to wards 11, 14, and 15, is there some tweaking with the recommendation so that we can make sure that we're not missing a group of people that should be vaccinated? That perhaps they just haven't been reached out to because they're in the rural community. We tend to concentrate efforts in Hamilton, the rural community. We need to somehow reach out to them more than what we're doing in Hamilton. I can tell you that in Flamborough, wards 14 and 15, they seem to have a tighter relationship with Cambridge in some areas than they do in Hamilton. So we wouldn't want them, Mr. Chairman, actually to be missing out on vaccines that could be provided. So instead of eliminating that large community-based influenza completely, we may want to re-examine wards 11, 14, and 15. I didn't include 12 because 12 seems to have a large urban component, and I don't know exactly what's going on in 12. 12 may want to be a part of that review just to make sure that no one's being missed.
Kim, thoughts on considering the outlying areas?
Through you, Mr. Chair, I'm open to providing the service that's required in our community. So if that's something that this council would like me to investigate, then I'd certainly be happy to do that.
So, Mr. Chairman, I think an amendment to A, just to at least have that discussion and make sure that we're not missing something by discontinuing it citywide, that we're not missing a need in 11, 12, 14, and 15, because we may not have had that discussion with those residents, to be quite clear. So with that, those are all of my comments, and I'll take the chair back.
Back to you, Deputy Mayor. Please put Councillor Pearson and Councillor Whitehead as first-time questioners and speakers on your list, and you'll have two motions later on, one to the Minister and one about tweaking the outlying areas. Thank you, Mr. Deputy Mayor.
Okay, so where to, yes, I have you, Councillor Partridge. Where to Councillor Pearson now, please.
Thank you, Mr. Deputy Mayor, and thank you for the information. I guess I just wanted to ask, when we're dealing with and going back to the concern of the doctor's offices and the refrigerators, power failures, and I guess that would be something with the province that has to be looked at. Have they looked at, or can we require them to put in battery backup systems? There are battery backup systems that are available. I have one on a sump pump at a rental property. They're not expensive. I'm surprised that they haven't thought of that now. And it doesn't entail any, generating type equipment other than a deep cycle battery and the system that you plug into as an alternative source.
Doctor?
Through you, Mr. Deputy Mayor, I don't know that we could require that under this. Recommend it, and that's certainly part of the discussions we've had with places that either have large amounts of vaccine that go through it, that have particular circumstances, that we do discuss those things with them, but I don't know that we could require it.
Councillor? So that's something that could be included in that recommendation for the letter to the Minister to have the discussion about? Yes, yes. Thank you. Kim, did you have anything to add to that? No? Okay. I have Councillor Whitehead, please.
Well, on that, I thought I heard that there was a monitoring of a thermometer. Is that a regular thermometer or is that a digitized thermometer?
Through you, Mr. Deputy Mayor, we actually procure and supply thermometers at a cost to physicians, and that we ensure that they're using one that we're happy with. It's a digitalized thermometer that's got a mercury-based probe, so that it mimics more closely the actual true ambient temperature of that refrigerator.
And it's battery operated?
It's battery operated, and we require them and encourage them to change the batteries anytime that they're changing their batteries in the smoke detector.
Okay, so in the event that you have a long period, is there the type of thermometer you're providing? Obviously, it doesn't print out, but can you look at the history in the last 12 hours on that thermometer and determine what had transpired?
Through you, Mr. Deputy Mayor, not with that thermometer. We do have, that's one of the reasons why we require them to document their temperatures twice a day. Unfortunately, if they're not in for a period of time, if their office is closed, it becomes more of an issue. And we always err on the side of caution for the integrity of our vaccine and just count the whole time period as the time where that excursion or that violation happened. We do, for those facilities that we find have constant concerns or issues with their temperature, do have electronical devices that are called data loggers that we put into their refrigerators, and that does monitor and it does give an electronic printout.
Okay, so I mean that's where I'm going, is that I mean at the very least, as far as how long the vaccine may or may not be exposed to the appropriate temperatures, clearly there's a simple solution in regards to the device you're utilizing to measure, and whether you plug it into a computer to give you a printout. What I know, I worked in the mining industry, and we had similar type devices that we could get printouts from when we arrived on shift to see what's transpired over the day. So that was just, I just want to feel that out as another option to ensure that at the very least we understand what that vaccine has gone through over the last 12 hours. have to arrive first thing in the morning for the next shift or over a weekend. The other issue I was going to ask about was the it's one of those senior moments. I was so focused on that one. I'll come back. Thank you.
You're too young to have a senior moment. Councillor Partridge.
You're too kind. Yes, Mr. Deputy Mayor.
And I have them.
Yes, thank you very much. And it's a good report, but I thank Councillor Pasuta for raising the issues about including Ward 15. But, my concern too is there's just incredible growth throughout Waterdown. And the vaccines have always been offered at the Waterdown District High School. And it is an event. It's like a community event. Everybody goes every year. You see your neighbors. It's on for a few hours. And I'm very concerned that Waterdown would be discontinued going forward. So my question through you, Deputy Mayor, is Waterdown going to be canceled with the approval of this report?
Kim?
Through you, Mr. Deputy Mayor, yes, that is what the report is recommending. I can tell you that Councillor Powers had similar concerns for the Dundas region, so I was able to pull specific numbers out for the Dundas region for him prior to this, and I'd be happy to do that for you as well. So, for example, in the Dundas area, in 2011, there were 1,300 people who attended the community clinic in Dundas, and last year it was 344. But there were 6 pharmacies in the Dundas area that administered almost 3,000 doses of vaccine.
And I appreciate that, but Dundas is not experiencing the explosive growth and the new homes being built that are being built in Waterdown. And I will tell you, I am concerned about that. And I cannot support this report if it includes closing down the Waterdown location at the high school without providing some sort of an alternative. And granted, I will say that up in Carlisle, many of the people in the rural area go to the Carlisle Clinic because it's a state-of-the-art clinic. It's been there for 30 years and, it's not an issue. But I am very concerned about the discontinuation of Waterdown. And I'm wondering, Mr. Deputy Mayor, if I could have your assistance, if we could have an amendment to the recommendations to have Waterdown kept in, or if there's another approach that you could suggest.
Thank you very much. Yeah, Councillor Jackson was going to take the chair once we have quorum again, and we were going to amend A to have staff look at wards 11, 12, 14, and 15 to ensure that we're not losing any services to the community, given that they're slightly different than what Hamilton is experiencing.
And
it's the lack of pharmacies that is the issue.
Right.
In the rural areas, they don't have the pharmacies and they don't have the doctors. So where are they getting the vaccine?
Oh, absolutely. I agree. And I appreciate that. However, what I'm hearing is that there would be an assessment done of that, but that they wouldn't be kept open going forward.
No, we can very clearly indicate that they not be discontinued 11, 12, and 14, and 15.
Oh, thank you. Thank you.
That's fair, and we looked at that. So
I appreciate that clarity.
And we'll have that discussion in a moment.
All right. Thank you. Those are my comments.
Correct. Okay. So is there any others? Oh, Councillor Whitehead, you eliminated your senior moment. You got it back.
Yeah, I mean, on that issue, I'd be concerned because I'm not about wasting resources or dollars. So if the assessment, I understand transition because to make an informed decision, you need to understand how many people are utilizing the vaccine. Going to the clinics. If in fact you're down to like 20 in Waterdown, for example, I'm not on for keeping it open in Waterdown quite. So until I see the numbers, I agree that we need to see the numbers.
That's what your senior moment was?
No.
Well, then let's go to your senior moment because we're going to debate that in a moment.
Fair enough. The second piece is when you had those numbers up relative to the vaccines, and I think the chair rightly had suggested that if you looked at the numbers, it looked like there's actual overall increase on the influenza, for example. So I know that my wife works in Toronto and got her vaccine in Toronto. I know that there's over 40,000 people that work outside this community. So I guess there's many other access points for vaccines that is hard to track. Have we done any assessment? Is there any way of doing an assessment of that may impact on what the numbers we're seeing.
Through you, Mr. Deputy Mayor, we have no internal way to track where other people are going who are Hamilton residents to get their vaccinations, but this is a provincial program and it's open to anybody who lives, works and plays or goes to school in Ontario. So if they happen to work in Toronto and it's convenient for them to get their influenza immunization at their workplace there, they're welcome to do that.
Also, a lot of travelers might be getting their vaccines that may be including those as well. I'm just saying there's other than what you've registered here, there's other opportunities for Hamilton residents to, in fact, get vaccines that is hard to track or is not reported.
Mr. Deputy Mayor, that's correct.
Okay, thank you. 1, 2. Okay, so we're back to quorum. I'll give you the chair.
Yes. Okay. Councillor Clark, your two amendments.
So I need to move a motion that the medical officer of health on behalf of the Board of Health write to the Minister of Health regarding the need to consider power failure alarms or battery operated backups on vaccine fridges.
Is that good language, Dr. Richardson? We're good with that?
That is good language. To be clear, we already have that within public health services. I don't know if you want to say in community vaccine fridges.
Ones that we don't have that we want to capture. Thank you.
Okay, move seconder for that, on that amendment. Sure. Councillor Duval. Okay, everyone's clear on that amendment? All in favor? Any opposed? Motion carried. Councillor Clark, your second amendment.
Thank you. The second amendment is an amendment to item A, where it indicates discontinuing large community-based influenza vaccine clinics, and that be amended that it not be discontinued in wards 11, 12, 14, 15, pending the community assessment that Dr. Richardson can do to find out whether or not there's, like what you did, Kim, with Councillor Powers, you were able to show that they are getting the vaccine through the pharmacy. So we want to make sure that we're not arbitrarily missing that in these 4 wards.
Seconded by Councillor Partridge. Kim, that's understood as well.
Absolutely.
Pending the review to come back here for those areas. Councillor Whitehead, to that amendment, please.
And again, we've done that level of assessment only in 8 wards, that we didn't do it for all 15 relative to where and what is happening, how many people are utilized in the clinic, and where, if in fact they're getting vaccines, how many of them are distributed, whether it's in those wards that are being identified. I'm just confused in why we're making exceptions, unless I understand why we're making exceptions. So is it my understanding we didn't do the assessment right across the board?
Kim, through the chair, please.
Through you, Mr. Chair. No, we didn't do an assessment. This was a request that was made directly from Councillor Powers, but recognizing that there are certain areas, as Councillor Partridge indicated, that there's that limited access to family physicians or to more concentrated areas where there's pharmacies. So no, I do have that data available. How meaningful that data is for more of our regions, I'm not really sure, because a family physician in Ward 8 might be seeing somebody who lives in Ward 6. I'm not really sure. But I can give you an overall picture of the number of family physicians in that ward, the number of pharmacies in that ward, and the number of doses that were administered or distributed for those areas.
I appreciate that. I think what's more concerning to me is one, that there is an alternative, an option. I think that's where rightfully Councillor Partridge was coming from, and so I certainly appreciate that. But the other piece is, if we've been setting up clinics in Waterton and no one's coming, then clearly what is this, I'm not sure what the answer is to that question, but we know that we got practical nurses sitting in a place with 20 people showing up, and for the majority of the hours they may not be showing up, and we're paying staff to be there for no reason. So I just want to make sure we're getting value for the dollar, and I want to balance that. So I understand that we need to do the assessment. It's clear, and then I will wait. I'll support what's here now and wait for that report to come back.
Thank you. Thanks, Councillor Whitehead. Appreciate that. Councillor Clark, second time on your amendment.
If you could come to me after Dr. Richardson, because she's been pointing at you.
Doctor, couldn't see you through my back.
She likes your shirt.
Through Mr. Chair, I was just I think the motion was, and that it would come back to the Board of Health. I was
Correct.
just suggesting, could it be made so that if just as with Councillor Powers, that if the ward councillor is satisfied that there are suitable alternatives in place, rather than bring it back, that it could just proceed on from there.
The ward councillors are here.
So, Dr. Richardson, thank you. I'll leave that to the mover of the amendment and the seconder, if they'd be satisfied with that, or they want it back to this body.
Yeah, the reason I moved it is not because I'm trying to make an exception for the rural areas. It's the fact that when I look at the document that here, I don't have the information. So I don't know what's happening in Waterdown and Flamborough. I don't know what's happening in Ancaster. I don't know what is happening in Winona and Glanbrook. We have the general picture across the city. What we do know is that in those wards, we have limited doctors, very clearly, one in one, one in another, and we have limited pharmacies available in those rural areas. So if that is the case, we need to be clear that an arbitrary decision of this body is not going to take away an opportunity in those wards. Not about special treatment, it's about making sure that they don't lose treatment because of their smaller population rural geography. I look to the ward councillors. If they're satisfied to have it come back to them for the decision, I'm fine with that. I'm trying to make sure that no one's getting a decrease in services when they still need it.
Okay, thanks, Councillor Clark. Councillor Partridge, to the suggestion of just to the ward councillors or back to this body? Councillor Partridge?
Well, and thank you, Deputy Mayor. I'd want some clarity on what that means, though, because I can tell you there are hundreds and hundreds of people that go to Waterdown High School. I go every year, and there's multiple people there administering the vaccines. It's not just a few people that dribble in over a course of hours. It's a constant flow and lineup of people that are lining up to sit down in the chairs. And so what I'm asking for clarity on is, what does that mean come back to the ward councillor? Does it mean we're approving the discontinuation today with the assessment only, and that it's the discontinuation is a given unless we come back to the ward councillor and then we have to raise it back here? I'm not sure what that means.
I think for your security's sake and for your comfort's sake, let's bring it back to this body, and discussions with the ward councillors in the interim can occur as well, Kim, before it comes back to this body.
I would agree with that.
How's that, Councillor Partridge?
But I want to know, does that mean that Waterdown and others will be discontinued?
It's staying open until the assessment comes back, is the way the motion has been worded.
Thank you. I appreciate that clarity. Then I can support it.
Thank you, Councillor Partridge. Councillor Ferguson on the amendment?
Yeah, I'm okay with it coming back to the ward councillor. Clearly, the spot you should look at is the Ancaster Senior Achievement Center. Secondly, it's located in a rural area. But if you want to come directly back to me, I'm okay with that, or back here. I'm indifferent, so whatever's more convenient for staff.
Thank you. Okay, so we'll bring it back here, and Dr. Richardson, in the interim, Kim can have discussions one-on-one with the various councillors. Councillor Clark moved the amendment, seconded by Councillor Partridge. All in favor? Any opposed? Motion carried. On the main recommendations as amended, moved by Councillor Clark, seconded by Councillor Pasuda. All in favor? Any opposed? Motion carried. To receive Kim's excellent presentation, moved by Councillor Pearson, seconded by Councillor Ferguson. All those in favor? Any opposed? Motion carried. Chair's back to you, Deputy Mayor.
Thank you very much, and I'm going to urge councillors to stay in the room. We only have 9. Councillor Collins, we need, is this a separate item or that motion? Thank you. So we need a motion from you specifically on port fuels and materials regarding the zoning. So if you could please present that motion.
I will, and it's, I know that we've already presented a motion at either GIC or planning for staff to investigate whether a rezoning application is required. So I believe we will be receiving something in written form at a later date. But I think we should give direction here today based on the comments that were provided by the presenters that our staff reach out to representatives of both the port and the company that you referenced, sir, to discuss the municipal legislative requirements that would come with the proposed facility that was presented to us here today.
Okay, so this is Board of Health, so we're making that recommendation, and it has to come back to GIC then, to be clear, so we don't lose that, because we don't have planning here, okay? So we can just add that to it. Your secondary on that motion was Councillor Maruda. Thank you. Everyone's heard the motion. Everyone has any questions or concerns? All those in favor? Carried. Thank you. I need a motion to receive Mr. Clark's presentation to us from the Port Fuel and Materials. Moved by Councillor Pearson, seconded by Councillor Collins. All those in favor? Carried. Councillor Whitehead, you have tinkled at me.
Yeah, actually.
Microphone.
New information. I just had a question in respect to public health. and the Pan Am, and whether or not there's any...
We're not there yet.
Okay, thank you.
I'm just doing catch-up because we
Yeah,
didn't
fair
have
enough.
a quorum at the time, but I will remember that and come back. The Clear Air Hamilton Progress Report, Dennis Core, if you could come down and make your presentation, please. Thank you for your patience today.
Thank you, Mr. Deputy Mayor, and thank you for inviting me to be here today. I did notice that item 8.2 about the citywide air quality model is a decision item. So I did want to offer, since you are having some challenges with quorum, if you had wanted to go to that item before mine, I can stay as long as necessary.
As long as the councillors stay, we're in good shape. I think we have commitment from everyone here to keep moving, so
okay,
let's have your presentation. This is item 7.3, councillors. Go ahead, sir.
Mr. Deputy Mayor, I thought it might be useful to start this presentation a little differently. You've seen me in wearing various hats over the years, so I thought I would try to put in perspective what's happening with the evolution of the air quality rules in our city. I would excuse me, I'd just like to affirm this kind of been a theme this afternoon, that Hamilton has been a leader in many, many areas to do with health. And in fact, we are recognized across the world as being a leader in air quality control. If you recall, we did win a United Nations award some years ago as developing the best practice worldwide for control of air pollution on a citywide basis. So we really started off and continue by focusing on point source control, and that continues very actively to the current day, and also control of emissions from vehicles. And as I will show you in a minute, the emissions from both of these areas are being reduced by about 90%, which is quite an amazing achievement. Though we continue to work on those two areas, we have continued to drill down to look at the local municipal health impacts, and not just on a citywide basis, but to get right down to the local and the neighbourhood monitoring, because of course, as far as our citizens are concerned, the air that really matters is the air that's about 1 centimetre in front of your face, because that's what you're actually measuring, and it varies by an order of magnitude as we go across the city. We've moved on from these kind of high-level, top-down approaches to outreach and education, to give our citizens the information so they can take personal actions and take personal responsibility, both to improve the quality of the air that they are breathing personally, and also to reduce the exposures that they themselves are generating. So how does Clean Air Hamilton fit into all of this? We started off with the Hamilton Air Quality Initiative in the early 90s. This evolved into Clean Air Hamilton. As we have seen the climate change challenges approach, that has been adopted as part of our responsibility. And we were challenged to develop an air quality task force, I believe by Councillor Marula, was it last year, the year before, that we need to bring forward action items to this decision-making group so that we could see what we should be doing. And I just would like to recognize that we have had international recognition, or the City of Hamilton has had international recognition for that. The Western New York Planning Association has just given an award to that approach, and they're putting it forward to the New York statewide competition for further recognition. Where do we fit into the big picture right now? Well, first of all, a lot of the things that we pioneered, people all around the world and across Canada are now starting to do. So the Canada-wide approach now looks very similar to what we started doing in Hamilton some years ago. It's called the AQMS, the Air Quality Management System. So we're not on our own. We do fit into the bigger picture. And the bigger picture right now looks like focusing on mobile sources, advanced transportation technologies, including vehicle maintenance. If you remember, the city was one of the first to adopt a green fleet approach, and still doing that, in-use diesel vehicles and engines. The standards that we all have to live by are being cranked down so that PM 2.5 and ozone standards are being tightened up, and there's much more stakeholder engagement. There has been a lot of talk about air sheds, and nobody was really quite sure what an air shed meant. So Canada-wide Council of Ministers of the Environment has defined that an air shed is a big area. It could be like a province or something like that. For instance, the air shed we would be part of would be the air shed that is impacted by the air coming up the Ohio Valley and blowing over south and southwest Ontario and Quebec. So the air shed is a big, big area. The air zones are subsets of the air sheds, so that each province essentially has to divide itself up into air zones. And Alberta and Saskatchewan and Nova Scotia have defined their air zones already, and Ontario has not yet defined their air zone, and they won't tell me what it's going to be, but I'm guessing sort of Hamilton, Niagara, Waterloo would probably be one of our air zones. The other thing that's going on at the same time is what's called the BLIREs, the Base Level Industrial Emission Requirements. So this focuses in on specific industries, develops regulations and codes of practice, process and timelines, so you may not hear from day to day or week to week or month to month what's happening with the major industries. Believe me, they are acutely aware of what is going on. They are negotiating with their respective provinces to find out how they're going to meet these new tightened standards so that we can continue to improve our air quality. So we fit right in with what's going on. So to Clean Air Hamilton, it was generated as a result of the 1997 Hamilton Air Quality Initiative report. You know what we do. I don't have to read it all out to you. It is internationally recognized. Our websites gets 1,500 website hits per week, and that's not just from our city, but from Ontario, Canada, the US, around the world. We've recently got Environment Canada back on our committee, and they describe what we do as essentially the gold standard that other people refer to. And one of the biggest deals that we may be called the gold standard is that we get representatives of everybody in the community sitting around the table, very diverse responsibilities, very diverse personalities, yes, and they're all really coming from a different place. But this is the place for air quality where people from all these different stakeholders get to talk to each other, not through the media, in an informal way. And what I maintain is that what happens around the table is often not as important as what happens when each of these stakeholders goes back to their own organization, sits in their own committees, and gets to tell the people in their own community or their own organization what sounds appropriate, what might need to be done, what's coming down the track, and I think this is very, very important. So why is it important? When I came here last year, after the unfortunate early death of our previous chair, Brian McCary, one of the questions I was asked about some of these maps that we produce with the green dots and the red dots, does that mean that someone is dying where there's a red dot? What do these maps mean? How can we tell that so many people are dying every year in Hamilton? So let me start by the CENES Health Assessment Report. It was partly in answer to these questions that Public Health commissioned an up-to-date health assessment of the impacts of air quality in Hamilton. About 180 people are dying every year in this city due to air quality. We can't point to one person and say, you know, Dennis Corr on 7 Spruceside Avenue died last year because of a particular air quality incident. But we can tell across the community that a certain number of people will almost certainly have died because of the levels of air pollution we have. And we can break it down to which kinds of air pollutants cause which problems. The total is 180. The respiratory hospital admissions are 390. The cardiovascular hospital admissions are 320, which often comes as a shock to people because intuitively you think that the respiratory problems are the ones that are going to be due to poor air quality. But really there's just about as many cardiovascular issues. And most of the health impacts are due to particulate matter, oxides of nitrogen and ozone that we know of. I think it's worth commenting that we have had and will continue to have a lot of concerns about coke oven emissions, benzoate-pyrene, benzene, and so on. And those are the stinky, obvious things that people living in those areas see. Back when we did the Hamilton Air Quality Initiative, we did do an evaluation of the hazardous contaminants. And I might just comment that when we started the Hamilton Air Quality Initiative, we were going to completely focus on the benzenes and the benzoate-pyrenes and so on, but I'd suggest that we go and visit some of my old colleagues over in the Faculty of Health Sciences at McMaster and run our study past them, and they were not complimentary. They said, we don't see anybody in the emergency department suffering from benzene poisoning, but we do see a lot of people with particulate and NOx and ozone problems, so you need to go back and rethink the whole story. So we went out of there with our ears ringing, saying, gee, that went well, because, you know, physicians are not always backward when they want to convey something to you. So we focused on all of the pollutants, the traditional pollutants as well as the hazardous contaminants. And at that time, we were not able to attribute a single cancer case, let alone a single cancer death, due to the hazardous contaminants like benzoate, pyrene, and benzene. I think that really needs to be updated, so that's a gap that we need to look at, because we now know a lot about the traditional pollutants and their health impacts, but it's probably time to go back and look at the hazardous contaminants as well. It's also important to point out that when we talk about premature death and hospitalizations, it's literally the tip of the iceberg. Like, it doesn't count the chronic bronchitis, the emergency room visits where you're not admitted to hospital, the parents who are lying awake at night wondering if their child is going to have another asthma attack. as you go down the pyramid, there are more and more of these things. So where do the risk numbers come from? All these deaths and so on. It really started in 1952 in the Great Fog of London, in England. And I was living in Belfast in the early 1960s, and I experienced some of these fogs. I remember I was riding my bike, my non-motorized bike, down to the university one evening. There were up to 7 cars following me because they literally couldn't see to drive. And I started to cough when I got down to the university, and I blew my nose, and it was black. Like, that's how bad it was. In 1952, in the Great Fog in London, they finally figured out there were 11,000 deaths. They knew there was something wrong when the hospitals ran out of beds, when the undertakers ran out of coffins, and the florists ran out of flowers. The government of the day put out a press announcement saying there had been a sudden flu epidemic. And then some of those pesky scientists and air monitoring people looked at the data, and you can see for yourself the smoke measurement, the sulfur dioxide measurement, and the deaths all coincided. It was due to the air pollution that had accumulated because the fog had kept it in, and because all those homes were heated with coal fires, and, you know, basically the vehicles had no controls either. And that started a 60-year epidemiology task where these data were refined and refined and refined, including with the Donora, Pennsylvania incident where a large number of people died. So now we can tell what relatively small variations in air pollution will do. And here's some of the most recent data to do with respirable particulate. And this is from essentially Environment Canada. Even a short exposure, a few hours to weeks, can trigger mortality and non-fatal events. Longer-term exposures increases the risk for cardiovascular mortality. And as I've said before, the greatest risk is my demographic. The overweight, the overconfident, the overage. And 80% of the mortality is in the over 65-year-old age group. And this relates directly to what we were hearing from the Lynn presentation earlier on. Environment Canada has looked at their regulations to see what the cost would be of tightening up their standards, and the health and environmental benefits will be 15 to 34 times greater than the cost of implementing these new regulations. Again, this relates directly to the Lynn presentation earlier on. As we improve the air quality, we make completely disproportionate positive benefits in terms of the people who are not showing up at the emergency department and not requiring health. I did a fairly simple calculation a few years ago, and I worked out that for every $1 of government funds at every level that we spend to reduce air pollution exposures, we save about $50 to $150 in the healthcare system. And if we can get into outreach and show people how to avoid exposures, that will help too. So a big part of what we're doing is monitoring the air to see what's there. We have 2 fixed monitoring networks. One's run by the Ministry of the Environment. The Ministry of the Environment used to run all of the air monitoring in Hamilton. The directive came from head office that there should be a level playing field, and industry should be paying for their own monitoring in all areas of the province. And then the Hamilton Air Monitoring Network was formed. There were cutbacks some years ago across the province in air monitoring, and we lost our East End Hamilton Air Monitoring site. And successive councillors have complained bitterly about this to the Minister of the Environment until they recently took matters into their own hands, and Public Health Services have reinstated the East End Hamilton air monitoring. And there is also in the works a purchase for some additional air monitors, really because the people in the East End of Hamilton have demanded it, and their councillor has listened to them, and that is now in train. We also have something that no other community really has in the province. Some other communities across Canada have it now, but we were the first. Where we get right into the neighbourhoods. We use a van outfitted with air monitors, which actually belongs to the Ministry of the Environment, and they work in partnership with us, so that we can see what people are actually breathing in their neighbourhoods. And I'll jump ahead a little bit and say, when we started this project, we thought we would do 5 neighbourhoods. We had 26 neighbourhood requests, so for the first round we managed to do, I think, 14 or 15, and hopefully this year we will be able to complete the second part of that project. So how are we doing? Very well, as it happens. In fact, if it weren't for that irreducible fact of 180 people dying every year, we could really pat ourselves on the back and go home and say, job well done everybody. But we are doing well. Total suspended particulate down 55%. You can read the numbers yourselves, but the one thing I'd like to point out to you is that most of the things that we have control over in Hamilton, such as benzene and PAHs and so on, are the ones that are down the most. And the deaths due to air pollution decreased from 229 in 2003 to 186 in 2012. Now, our population has increased in that time, so we're actually doing even better than this looks. So we've done a lot. I was going to say we got to keep on trucking, but trucking is not a good thing to be keeping on doing. So. These are the poor air days and smog advisory days. You can see there was a trend in the early 2000s, but it's coming back down again. And this is the trend in the last decade, essentially. If you look at the top right-hand corner, the thing that's really recalcitrant is ozone. And ozone is generated in the atmosphere by a mixture of other pollutants, so we don't have direct control over it. But our emissions do contribute to other people's emissions downwind, so we still have a responsibility to control it. Inhalable particulate has come down steadily. Nitrogen dioxide has come down steadily. As I said, the really dramatic things are the things that tend to be generated in Hamilton, and that we, by we, I mean the city, the industry, the Ministry, the Environment, can do something about. So TRS, way down. This is the stinky stuff that you used to really smell when the wind was from the northeast. Benzene is down. Benzoate is well down. Let me just look at the tail end of these curves in a little bit more detail. We were worried about benzene last year because it seemed to be trending up, but you can see it's flattening out and starting to come down. The Canada-wide regulations are going to really crank down on the benzene. The benzoate also a couple of years ago seemed to be trending up, but they're starting to bend over and come back down again. And I'd like to just make a comment about these regulations. The Ministry of the Environment has been working intensively with the industries, and I guess the industries have been working intensively with the Ministry of the Environment. A lot of this material is coming from coke ovens. So U.S. Steel, for instance, has a number of very detailed control programs, and AMD is going to shut down one complete coke plant and do a lot of work on the other two plants. So But what is going to have to happen is the new standards are so tight that there's going to have to be a lot of negotiation around it, because, for instance, the new benzoate-pyrene standard is not even met in rural areas of Ontario. It's not met in Chatham or places like that. So this is going to be a challenge over the next few years. But we do anticipate that these numbers will continue to come down, and there is a lot of intensive work going on. As I say, you don't necessarily hear about it on a week-to-week basis, but the long-term trends are there. We have tended to show you the last 10-year trend, but this year I went back to MOE head office and I asked them for the data from way, way back, from the beginning of the 70s. And if you look at most of these curves, there's a big spike here. What it essentially says is that since we started, and I say we collectively, the city, the ministry, the industry, the people, the controls on individual vehicles, we're actually looking about a 90% improvement in air quality, which is a huge success, but we cannot stop. I'd like to talk a little bit about the enhanced monitoring that has gone on due directly to the city initiatives. There was a pilot project, a so-called pilot project at Sam Manson Park. I did indicate to some of the people in public health that if they thought they were ever going to be able to take out this monitoring station, good luck, but that's really your decision. You can see that the air is mostly clean. The AQHI values were low, and there was the lingering concern about the Red Hill Creek, but if you look at this directional information, pretty well all of the particulate is really coming from the southwest area.
Doctor, I'm getting indications from councillors that some will be leaving at 6 o'clock and we'll be approaching a quorum issue. So if you could go really fast track.
Start to talk really fast. Okay. This is the mobile air monitoring neighborhood studies. As I said, 15 neighborhoods. We're hoping to get funding to complete the rest of the neighborhoods. Hopefully we'll get that this year. Once again, the worst air quality you can experience is out on the highway. Outreach and education, there's been a lot of work done. We specifically asked for the Air Quality Health Index, the Canadian Air Quality Health Index, to be brought to Hamilton first, and it was. Public Health are doing a lot of work on outreach to make people understand it. We're going into the schools, we're working with the children, we're explaining the Air Quality Health Index to them, and we're also monitoring the air around their schools. So these are the red and yellow dots, so they can see what the best way is for them to go to school, and we're expanding and continuing that program this year. Totally Transit. The Air Quality Task Force, which has already been presented to you, has come forward with 10 recommendations in the areas of air modeling and monitoring. I'd just like to put out a word for the air modeling, because we don't have a really good model currently for where all the different sources are in Hamilton. And if we had a really good model, it would help us refine our monitoring as well as assist us with our control programs in the future. I just want to quickly mention the Upwind Downwind 2014 conference, which was quite non-traditional for us. It talked about green spaces and planning, which is an area where the city has a big impact. And it is astonishing the benefit of green spaces and trees. It improves public health in a very dramatic way, not just mood. It improves healing rates after operations. It includes the general level of public health. It lowers blood pressure and is really something that I think the city should really put a large focus on. We have an amazing city, and I think we need to promote and enhance those aspects of it. I don't think I need to say much more. There's just one thing I would like to highlight about climate change. You've already heard the other presenters, but there's a really good new program. If you take out the industry and look at our greenhouse gas emissions, the residential greenhouse gas emissions are the largest of the remaining. And there is a great new proposed program which will be coming to you, which is called the Area Improvement. I forgot that. Nobody's going to help me out. It basically offers to our residents the opportunity to have someone come to their house, review their house, make a recommendation as to what technologies they can put in to reduce their greenhouse gas emissions. The city will pay for it and then take it back out of taxes, so that you could have someone come to your house and say you should do this, this, and this, and you will save $100 a month, but you will only have to pay $50 a month to us in taxes. And it stays with the house, so that even if you sell your house, it's a benefit to the person who wants to buy your house. So I just flagged that for you. It's going to be coming to you, and I think it could be a widespread adoption through the city of Hamilton if it is promoted properly. When I told my own daughter about it, she said, "Dad, if that ever becomes a reality, I want you to tell me about it first, because I want to be in the first in line for my house improvements." Anyway, sorry to be rushing through this.
No, it's we owe you an apology for giving you a little bit short thrift, but I'm running out of counsel.
One last thing. This is where we really should pat ourselves on the back. In terms of electricity generation, Ontario is a world leader in terms of non-polluting electricity generation. I know those poor folks at Ontario Hydro take a real kicking all the time about, their charges and so on. But if you look at China and the US and their coal burning, and even Canada-wide, we are the best. 80% of our electricity is generated from non-polluting sources. That is amazing. And removing coal-fired generation from Ontario was the biggest single green initiative in all of North America in the last year. So thank you.
Thank you. Councillor Marula, please.
Thank you, Mr. Deputy Mayor. Let me start off by thanking Mr. Corr for his presentation. As always, he's very thorough, and his expertise is truly appreciated. Let me start off by saying that I think the number one statistic that is really striking but doesn't really hit home with many people is the fact that 180 people locally die annually as a result of air quality issues. Imagine, Mr. Deputy Mayor, if we were talking about 180 murders a year, how people would be storming this hall for answers and action in order to basically Having said that, the fact that we have a silent killer and nobody is acting truly speaks volumes about the fact that we're not communicating, I think, this issue clear enough, strong enough, and the province clearly has dropped the ball to the point that we, as a city council, have to step in over and above the downloading issue to pay and do the job that the province isn't doing. So through you, Mr. Deputy Mayor, Dennis, from your expertise and your knowledge of the way the province works, is there any light in the tunnel with respect to a change in legislation for mandatory legislation for monitoring and enforcement to the level of pre-1995? Is that going to occur anywhere in the near future, or do you feel is it a lost cause?
Dennis.
Through you, Mr. Deputy Mayor. Well, of course, I do have to take issue with you, Councillor, on some of the things you're saying. And I do have a reason for putting in most of the slides I put in. When we see a 90% improvement over baseline, to me that says everybody's playing their part. You're playing your part, the province is playing their part, and the industry is actually playing their part too. And that may not be the most popular thing to say, but when you can reduce pollution by 90%, that's a huge success. I will agree with you that we could strengthen our legislation. You can see some of the problems that Hammond is having with some of their members dropping out. When I look at the AQMS, the Canada-wide stuff, for instance, I think it's in Saskatchewan, to run these air zones, it takes money, it takes staff, it takes time, as the previous climate change people said. So anybody who's on the National Pollutant Release Inventory, anybody who is on the list, who's not like a little guy who can't afford it, there's a fee. And it's part of legislation. And that includes monitoring, and it includes the kinds of things that I'm talking about. And when we started the Hamilton Air Quality Initiative, we were given some options as to how to proceed, and one of them was, well, we could develop a regulation for you to deal with Hamilton Air Quality Initiative type situations where a community wants to do this sort of work. But it would take 5 to 7 years to develop the regulation. Silly me, I thought, let's get right to it, we won't worry about it. Well, 5 to 7 years later would have been the year 2000. How I wish that we had more detailed regulations requiring emitters to monitor, requiring the kinds of things that you're talking about. And I think even though it's maybe a long-term process, we should be going asking for it. But it's starting to happen on the Canada-wide level already, like with the tightening of the standards and all those kinds of things. But some of these things are hard to enforce, and they do need to be made more enforceable. Yeah, you're right. Hardly.
You, though, Mr. Deputy Mayor, just on the issue of the 90% improvement, could that have been correlated to the fact that we have a decrease in industrial activity as well? Or do you feel that that's not a relevant...
Sorry, through you, Deputy Mayor. I realize this is something that has come up recently, and I would say the answer is absolutely not, is what I want to say, because most of that improvement took place while the major industries were going full steam ahead. If you look carefully at some of those things, there's a bit of a dip around 2008 when there was a worldwide recession. But I'm looking at that data and I'm not seeing like a big drop due to a particular industry being reduced. I just don't see it in the data.
So if 180 people are dying presently, prior to this improvement, how many people were dying a year in Hamilton?
Before? Maybe 5 or 6 times as many.
And that would have been what year?
Before. Like before it was reduced?
Yes.
Like because the health effects were the same per gram of air pollution. We had a way bigger problem than we realized.
So over 1,000 or near 1,000 people in Hamilton alone were dying from air pollution.
I have not made that calculation, but I can tell you that a certain Mr. Eric McGuinness, who used to be the environmental reporter for the Hamilton Spectator, called me about 15 years ago when I happened to be air quality chief, and I had been telling people that nobody was dying every time we did a report, and he said, have you looked at the most recent data, Dennis? And I said, yes. He said, how many people do you think are actually dying in Hamilton? And I said, by my most recent back-of-the-envelope calculation, maybe as many as 20 a year. And the banner headline in The Spectator the next morning was, MOE says bad air kills 20 people in Hamilton. And I really underestimated it. And my good friend and your colleague, Dominic, was waving that newspaper in the legislature that night, and I don't know how I didn't get fired. But yeah, we've learned more and more over the years, but clearly this was a problem that was far worse than we thought.
And again, brings me back to how this started. If people only understood, like we spend $120 million a year in policing for public safety.
Yep.
And if we had 180 murders a year, how much are we spending for equality locally? And the fact the province, their allocation of policing versus air quality, people are just missing the boat on the severity of this particular issue. I think it's a crisis and truly needs to be addressed far more aggressively than we, the province, and the country are presently pursuing it. So I appreciate your time, sir.
Thank you,
sir,
Councillor.
thank you very much.
Councillor McCaddy, please.
Thanks, Mr. Chair, and thanks, Dennis, as always, for the great presentation. And it's really interesting to see that 1970s data. Thanks for including that, because it gives a larger perspective. But I think following on Councillor Marula's comments, though, I think a lot of people would still see the 180 people dying per year or the 700 hospital admissions is still pretty high. Most people would be shocked by it, I guess, if they weren't as familiar with this stuff year in and year out as you are, as we are. So we've been looking at this data for a long time. So we're doing a great job monitoring and that sort of thing, but I'm just wondering where the next big gains need to be made to reduce that to a much, much lower number. Are we going through a latency period right now where we're seeing cancers, we're seeing sicknesses based on 1970 and 1975 when things were much worse? Is it really the U.S. stuff, the ozone stuff in the U.S. that needs to be job one, and we need to get a federal response, the way that acid rain occurred back in the 70s? I think many of us are frustrated or wanting to hear more about what we can do to make a difference in addition to the monitoring data.
Through you, Deputy Mayor. Yeah, thank you for your comments. And it was said earlier today about some of the health stuff. I don't think there is a silver bullet. And in fact, if you look at the improvements, it's like 2% a year, 3% a year. It doesn't look like much, but over 10 years, you've got 30% and you've got 40%. And I didn't really have time to go through it, but really that's what the task force was trying to do, to come up with a list of really concrete recommendations that we can, at our level, continue to move forward. And I really see two or three key things. One is to get this model going, and then we'll have numbers, we'll have sources, we'll have not just raw emission numbers, but impacts, and be able to compare them with diesel vehicles and cars and all the rest of us, and that will be a signpost for the future. So that's one thing. And the other thing, the local improvement charges thing, I see that as a real step forward, like a very concrete step forward. And the third thing is the outreach. Like just going around with the van, people should never be jogging beside Main Street or King Street. They should be jogging along our trails and in the green leafy spaces and so on. There's a big outreach job which you've just identified. And I agree with what I said. My version is, what if you told everybody there were 180 people dying of cholera every year, and they'd be mass panic? Or there were 2,000 people dying of cholera in Toronto. I mean, people are just as dead. Like, it's just one is a kind of a more horrible way to die than the other. So we're continuing to work on it. We share your frustration, but it really is a multifaceted problem, and we just have to keep chipping away at all aspects of it. And everybody who comes here always wants more funding and so on and so on. But if you look at the level of the problem, we do need to keep putting resources in. And I'm with Councillor Whitehead. I don't believe in throwing money at something just to throw money at it. But when we get good programs coming forward, you know, we should be well prepared to fund them, not just for the sake of doing it.
Okay. Love your work, Dennis. Thanks very much.
Thank you very much. I need a motion to receive the presentation. Moved by Councillor Partridge, seconded by Councillor McCaddy. All those in favor? Yeah. Carried. I need a motion to receive the Board of Health Report 14019. Moved by Councillor Duval, seconded by Councillor Whitehead. All those in favor? Carried. Thank you very much. Thank you, Dennis, for appearing today. We're now at 6 o'clock. Are you leaving now, Councillor McCaddy? So 1, 2, 3, 4, 5, 6, 7, 8, 9. We are now at quorum, just so everyone knows. Number 8.1 is the streets bylaw review and options for dust control. Is there any discussion regarding 8.1? Seeing none, I need a motion to receive the report. Moved by Councillor Morrow, seconded by Councillor Duval. All those in favor? Thank you. On item 8.2 is the airshed model procurement. This is the one that there was some funds involved. So is there any discussion on 8.2? Councillor Moore is moving the recommendation. Is there a seconder? Councillor Collins is seconding the motion. Any comments or question? Seeing none, all those in favor of the motion? Anyone opposed? Item is carried. Item number 9.1, Councillor Morrow, do you wish to proceed with your motion regarding the gasification operation? Not at this time, thank you. So the motion will remain tabled. Item 9.2, a request for ongoing funding for the expanded community health education navigator approach to healthcare. Councillor McCaddy is not here, so we'll continue to table his motion. Are there any notices of motion? Just 1 second. There are no notices. General information. Councillor Whitehead, you had a question earlier, and I'll put that now under general information.
No, I may have missed it, so correct me if I'm wrong, but with the Pan Am Games coming and there's a lot of strategy around security and around all those other fronts, the question I have is what implications will it have, could it have, or what action plans are being put in place by public health to address the entourage of you know, all the professional teams coming in and fans and so forth? Is there a strategy on the public health side?
Deputy Mayor, there indeed is. I'll just ask Brent Browett, who's been working on that.
So it's a long day. I just want to ensure there's something in place. Yep. The next Board of Health meeting, could we have a presentation on it?
A presentation? Yes.
Great. Okay, so you'll move that as a motion, seconded by Councillor Partridge, the presentation with regards to that. All those in favor? Thank you. Item is carried. I need a motion to remove the items on the OBL list as indicated in the agenda. Moved by Councillor Pearson, seconded by Councillor Jackson. All those in favor? There is no confidential information. Motion to adjourn. Councillor Morrow, Councillor Pearson. All those in favor? Carried. Thank you.
I haven't checked. It's there. I'm right. Yes. Great. No box. Yeah. Thanks very much.
So, thank you, Jasmine. Please keep that in mind for the future. Thank you very much.
Dennis, I'm sorry for the short trip, honestly. You know, it was a crazy.